Hi, so thank you all for having me today. My name is Robin Shepard. I'm the clinical manager for Vydence USA. I'm thrilled to be here at headquarters MRP in Park City, Utah with Kiki. And I'm going to go through two didactics now. We'll break to work on some models, and then we will finish with our other two didactics. We're going to start with pigment. So I figured keeping pigment together and ablative and non-ablative together later on this afternoon would be a good flow. But we're going to start with IPL and PICO, specifically starting with IPL. So our Etheria, we have an Etheria MX, we have our Xi Alexandrite, our Xi YAG. All of those bases can house any of our hand pieces. The Etheria tends to be, a favorite for smaller med spas. It does plug into a 110, and it's a little bit, more compact. The Xi Alex and Xi Yag are a little bit bigger, and they do house all of our hand pieces as well as the 4 fibers that we're going to talk about, I believe, tomorrow. They're a little bit bigger. They do need a 220 volt to plug in, but they are very powerful and allow for quick treatments. Okay. So these are our 8 hand pieces, but some of them get a little repetitive. Like if you have the Achroma, or if you have our Pico, you don't necessarily need our Achroma Q switch. Achroma Q switch came out first. It's a little less expensive, but we really don't sell that much of it anymore because our Pico definitely takes precedence. And same thing with our Go Smooth, the erbium glass, the 1540. Since our Pro Deep has come out, that has kind of been rendered obsolete. So there are other hand pieces, but we primarily sell, I call them the Fab Five, or our Core Four. And our Core Four is IPL, Pico, Dual Mode, and Pro Deep. But then that long pulse, if you're not going to get a Xi YAG, if you get the Xi Alexandrite or you get the Etheria base, you can add the long pulse handpiece and still have that 1064 long pulse capability. Okay, so this is a timeline of, IPL, kind of when it started, when it got FDA approval. What it was approved for initially was for hair reduction. But now, as we most commonly use it for, is pigmentary and vascular lesions and skin rejuvenation. For me, I've worked with a lot of IPLs, and I kind of say that IPL is an IPL is an IPL. It can do what it can do, and it has limitations. I think it's a very underrated tool. But when it's used properly and in the right hands, it's an amazing tool. It's one of my personal favorites. And the thing that I love about Vydence system is they've kind of taken all the things that are popular and easy with certain IPL systems and adapted it into ours. And anything that was cumbersome or kind of, unnecessary left behind. IPL is not a laser, as I'm sure you all are aware. It is a flashing light, but it is still a photothermal and photochemical interaction. It is a broad spectrum light, and here, not always, but in this case, the larger the number of the wavelength, the deeper it's going to go. And then penetration is proportional to wavelength. So why is it not a laser? Lasers are collimated, monochromatic, and coherent. IPL is divergent, it's broad spectrum and incoherent. And it is restricted to the surface of the tissue. And the relationship to the target chromophore, IPL's target chromophore tends to be hemoglobin and melanin, whether it's melanin from lentiginous or for hair. So there's photochemical like LEDs, photothermal like lasers and IPL, and photomechanical like Q switch and Pico. Those are the different interactions with tissue. And then here are our different filters and what they treat. So if you look, I don't know if you've got the clinical reference guides yet. You have?
Yes.
So I always make a joke. The IPL clinical reference guide tends to make a lot of people go cross-eyed because it's 3 pages long. It's a lot of numbers that are being thrown at you in a lot of different scenarios between the different filters, the different tips, and the different indications that we're treating in skin. And so I kind of throw that out the window and I make it very easy. The wavelength that I use the most is the 540. And you can see here the recommended filter for indication. I use IPL for pigmented and vascular lesions and scarring. I don't necessarily go for it for hair removal because I think there's other modalities that are better. And then acne, if you have our Pro Deep, I think is way more effective on acne, but this is still good to kind of kill some P. acne bacteria. But again, my primary use for IPL is that pigmented and vascular lesion. And the 515 is really good for superficial pigment. The 580 is really good for vascular. So that 540 is a really nice in between that can do both.
So I quite often stack filters.
Mhm.
Is that something that the Vydence IPL can do?
For sure. So sometimes I'll use the 540, and if I notice a couple stubborn lesions or deeper pigment, I'll go to the 580. I don't really use the 515 that much anymore just because the 540 is very efficient.
Yeah. So I typically go deep and then superficial.
Mm-hmm.
So okay, perfect.
So we're just talking about pulse time. And we know that IPL pulse time is kind of opposite for other modalities like ablative and non-ablative. So the shorter the dwell time, the more intense it is, more focused that it is. And it's just talking about thermal relaxation time, which I don't want to bore you guys with that stuff. Whenever I do my trainings, IPL and Fitzpatricking is like the most important component of IPL. I started my career with training for IPL because there was always a problem because of lack of proper skin typing and using inappropriate settings and wavelengths. There is a way to do this very safely and effectively, but I think it always starts at skin typing. And personally, we can use the questionnaires, we can ask certain questions, but patients a lot of times don't know how to answer some of the questions, or they don't understand what ethnicity really means, or they don't really know. So I encourage ask the certain questions, but also look at their skin, look at scarring on their body. I look at their arms, ask if they have any recent scars, older scars, see what their skin does in the sunlight. Ask those certain questions, and that's always helped me. And then I always classify Asian skin as fours, no matter what color the skin is, but it's a 4 or 5. So at minimum a 4. So I don't necessarily use IPL on Asian skin. I try to train on it's a 1 through 3 fits only because I say I like to sleep at night.
Yeah.
Yes. And that's the problem with IPL, right? Like it can look fine in office. It's when they go home is when it will burn the next day. So if you have a Pico, which we are going to talk about, there's really no need to push it.
Yeah. And actually our Pico we're going to be doing today is on Fitz 6 and also Fitz 5 Asian skin.
Nice.
So yeah, I'm excited to try that out.
Okay. So the wavelength ranges from 400 to 1200 nanometers. It can operate in static and dynamic mode. Dynamic mode is a setting on the Xi, either Alex or YAG. However, I found a setting to do on the Etheria to still do in dynamic. You're not going to find it anywhere. It's just a way that I kind of manipulated the setting. It's the same setting, but it's going to be 8 millijoules at 5 milliseconds, and it'll go to 2 hertz, which is, not as good as 3 hertz, but it's still in motion, and you can still do that technique on like chests and neck and arms and prevent the demarcations.
Yeah. Okay.
There are 6 different filters. There's a 400, 515, 540, 580, 640, and 695. And then my favorite part are the Vascu tips. There's that standard 40 by 12 millimeter rectangle. But then there's also a 12 by 12 square and an 8 millimeter round diameter Vascu tip. So as anyone who's ever used IPL before will know that rectangles are awkward on the face, especially the forehead. I've seen a lot of singed hairlines and eyebrows and just burns from not making good skin contact. And so Vydence went ahead and made that square piece, which is amazing for foreheads. It just takes a couple extra pulses because it is smaller, but anywhere on the forehead, it will lay flat and you can see exactly where you are to avoid the eyebrows and get right up to the hairline without burning anybody.
Sometimes I like that on the nose too. Anything that just kind of hangs off, I use like a tongue depressor or a gauze to kind of.
Yeah, no, you don't have to do that now.
So nice.
Yeah. And then the 8mm round, I'm sorry, I'm just gonna close
Yeah,
this.
you're
okay. Okay. The 8mm round is perfect for getting inside the crevice of the nose for those telangiectasias or broken capillaries, cherry angiomas, hemangiomas. I have used it on other areas of the face. I prefer a long pulse, of course, but it, in a pinch, it can work. So I really do
Cool.
like those VascuTips. And everything is changeable. So the wavelengths and the cutoff filters just magnetically attach in the handpiece itself. And then the VascuTips will cover the rectangle.
Do we put gel on?
So Brazilians hate gel.
Okay.
They hate it. So in dynamics mode, yes, you have to have gel, but for the traditional stamping method, you don't.
Interesting.
Yeah.
Okay. So then you wouldn't necessarily need to put the gel on the inside of the adapters before putting it on like other IPL systems.
Oh, no.
Okay.
Yeah. So they like less mess. And so I don't do dynamic mode on the face. I just don't think there's enough surface area
Yeah,
to be in motion. So I always do the stamping method on the face, but literally anywhere else, I will do in the dynamics mode.
So today we won't, unless we do dynamic, we won't use gel.
Which we should do dynamics.
You should, yeah.
Yes, so I can show you on anyone's like chest or
Yeah,
arms or
we'll do
something
that.
like that. So, but you can combine, but yeah, if you're just doing faces, you don't need gel.
Interesting.
Yeah. I mean, this is pretty common nowadays with IPLs, that square wave pulse technology for that delivery of energy. So there's no heat spikes. It's nice, uniform, consistent delivery of energy. So there's just no burns. And Brazil and this didactic will kind of tell you that you can use some of these wavelengths on darker skin types like skin type 4.
Mhm.
I personally just don't, but with the deeper filters, like you technically could just with,
Yeah.
with conservative settings. It is a sapphire cooling plate. Another benefit of the Xi is that, it can do dynamics mode a little bit faster, but it does get a little colder. That's another benefit of the Xi. But it is still 5 degrees Celsius on the Etheria, so very nice and cold. And the way I train on IPL is I don't think it should hurt. It's not a picnic. It's not enjoyable necessarily, but you can get to the clinical endpoint, and it shouldn't be uncomfortable. So, and I can show you that later today. But that cooling really does help protect the epidermis and mitigate any kind of discomfort. Broad coverage area, so the 40 by 12 is a pretty big size. And then again, the VascuTips. Sorry, this gets a little redundant.
Okay.
So here, and then this is just a video of the dynamic mode. So you do put a little bit of gel and you basically find 2 columns the size of the rectangle, and you have to just kind of control that knee-jerk reaction and move really quickly because it's going to be beeping and flashing pretty rapidly. So you just have to go at a nice controlled pace. Then you're going to go over the area about 3 or 4 times until you see the clinical endpoint of uniform erythema and some of the spots darkening. It also is a lot more comfortable for the
Yeah,
patient.
for sure.
And you will literally never give anybody those zebra striping, hypopigmented.
Could you
marks.
do passes in the different directions to get
Mhm.
that cross hatching?
Yeah.
And then also, oh, I forgot what I was gonna say. Oh, I'm assuming the settings are a lot different than static, so they're 2 separate.
Yes, so it's basically one setting for dynamic mode on the Xi or the Etheria.
Okay.
And then you'll get to a point where, IPL will plateau. I always feel like it's not good at low contrast
Yeah.
litiginis.
Mhm.
So either you can do a couple, dynamic, the first 2 sessions in dynamic mode, and then if they have that little bit left over, as long as you've gotten rid of a majority of the sun damage, you can then stamp and obviously you shouldn't have to do as much.
Okay.
And then you can be a little bit more aggressive because you kind of took out a lot of the color, the discoloration. Or my favorite thing to do is pair it with Pico.
Okay.
I tend to pair IPL with Pico in the same session a lot because Pico shines at low contrast lentigines and really bringing out that extra pigment. But it takes longer. So IPL kind of does its thing and then Pico can go in and kind of clean up after it.
Right. Okay, perfect.
You do have to calibrate your IPL. So there's a little notch towards the back of both the Xi and the Etheria. And it only asks that you do that pretty much once a day or when you first turn on the machine. So if you switch out hand pieces, I think even turn it off for a certain amount of time, it's not going to make you do it again.
Okay.
But if it's been sitting off for a while, then you might have to calibrate again.
And it's on both the Etheria and the Xi.
Yes.
Okay.
And it's really quick. It's just measuring to make sure not only is it firing accurately, but it's cooling accurately. So it's just for safety. But it is the only handpiece that you do have to calibrate throughout all of ours. That's good to go.
Quick.
Yeah, very quick. So the interface and parameterization, I mean, this is what we have now. It should be changing within a year when we get the new models. But essentially, it's going to look like this. And it's the same whether you're using the Etheria or Xi in terms of configuration, but just color is going to be a little bit different. But in the very top left, it's always going to say what handpiece has been plugged in. And in the top right, it's going to say what filter. Or if it's a different laser, it's going to say what tip is being used. And then just under the IPL, that's that other top left, will always be your fluence or your power. And then your pulse width is always going to be underneath that. So fluence and pulse width are always together on the left. If there is contact cooling within your handpiece, that will always be on the top right. And then the frequency or repetition rate measured in hertz is always going to be on the bottom right.
And I see you can change the cooling
Mhm.
too. So maybe pigment, you can go a little bit warmer.
Yes, so sometimes in dynamic mode, if I'm plateauing, but I still want to do dynamic mode, instead of manipulating the energy, which you can't really do, I turn down the cooling. Yeah.
So one would be the warmest. You
Yes.
could go? Okay,
Mhm.
perfect.
I tend to operate at full cooling.
I do too, but sometimes that sticky pigment.
Sometimes, yeah,
I-
you have to go down,
yeah.
and that is a nice pearl. Yeah, you can do that. The home screen, so whenever you want to switch a handpiece out, you always have to press the home screen. If you tried to pull the handpiece out and switch it in this screen, the device will yell at you.
Okay.
And it's not the end of the world. You would just have to shut it down and restart it. But just try to be cognizant of that. The bullseye looking button there, that is for firing. And then the other on the other side of the up and down switch is the standby. So I know that's a little confusing because that is kind of the universal symbol for on, but that it's on, it's just on standby. And then
Standby's
yeah, the bullseye, I say that's the bullseye means fire.
on. Okay.
And then the very bottom right, you're gonna see your counter. And so if you are doing dynamics mode or if you're doing Pico in motion and you need to, it's more about number of shots and you're accumulating energy in the area and you need to notate that, it will keep track in that bottom right.
And foot pedal.
Most of the time, yeah.
Okay.
So IPL does have a thumb switch, but everything else is operated by the foot pedal.
Every other handpiece is operated by the foot pedal. Oh,
Yes.
interesting. Okay.
IPL is the only one that has the foot switch or the thumb switch.
Okay.
And as you can see, this is the Xi interface, so it's very similar, just a different color.
Okay.
This is that clinical reference guide that I was alluding to. This is the one that is 3 pages long. It's a lot. When it comes to IPL training, I just kind of say like, we need to find the clinical endpoint. And so we're always going to test. And the range, you're going to find that you're going to be using the same settings a lot. Or the same range of settings a lot. You're going to use that 540 filter more often than not.
Sorry to interrupt,
Oh,
guys.
it's okay.
Kiki, tomorrow or today, is Steve going to be a demo patient for you? Is that for a demo, customer demo, or
The training.
Oh,
I
it's
can
for the
cancel
training
it.
session?
Yes. I can cancel it
The
if you
10 to
need.
12.
Yes, I can cancel it or remove it if you need me to.
Because I just need to assign them each a class, basically.
Do you want me to have that?
Oh, sure.
So if Steve, I'll just have Steve as a member of that session, and then you.
Okay. Sorry, guys. Okay. All right. So, with IPL, I think it's just more based on critical thinking and that clinical judgment, and then looking for the endpoint in the skin. So, but the settings do become a little redundant because you're essentially treating the same indications and the same skin types, and so you're gonna find your groove. But I always do a test spot.
Do you see a lot of purpura with that? Okay, that's good because I
No.
like to treat.
Yeah.
Yeah, we're good.
Okay.
Sorry, we just had to mute for a little bit.
No, yeah. So I've heard some horror stories with.
So
I just
we're
found
live.
out I'm the guinea
We're
pig.
live.
Huh?
We're live.
Oh, yeah, sorry.
No, it's
It's
okay.
okay. No, I've heard a lot of. Oh, am I still muted or no? Okay.
I think you're good.
Okay. No, I've heard some horror stories about IPL with a lot of swelling and purpura, and that's just not how I
Okay.
do things. I'm always able to get the clinical endpoint and really good results without, like I said, causing that downtime or pain. Dr. Eubanks, who was my supervising physician for years and who was my laser mentor, loves to use IPL in conjunction with our Pro Deep and dual mode for scarring as well.
Yeah.
So whenever you have stretch marks or scars that are purple or pink or red, it's amazing to start with this.
Mhm.
And then again, you can use those VascuTips to kind of really hone in on if it's stretch marks or scarring. So you don't have to do like a broad area. You can really treat even smaller lesions and pair it with our other wavelengths to give a really well-rounded treatment. So freckles, cafe au lait spots, hyperpigmentation, post-inflammatory hyperpigmentation. I always talk about freckles. You know, freckles are more difficult to treat than lentigines. Freckles are written in our DNA code versus something that was environmental. And I always say, if you're going to remove them, just really make sure that they're okay with losing freckles. I've done a lot of treatments where I've treated lower face, but I've had to leave freckles alone on like the nose or upper cheeks. So I just like to point that out as being, cognizant of someone having true freckles and making sure that they understand that this could potentially remove them. And then this is what we talk about when it comes to the clinical endpoint. This is what it should look like after. If it's not really looking like this, then it's not, effective. And this is an example of layering wavelengths. So they started with the 540 and then did the 580 after. Or maybe the other way around. 580 first. It kind of is written like they did the 540 and 580 first. Sometimes I'll do like the 540, and if I'm not getting really what I want, then I might use a VascuTip and spot treat with the 580 instead of doing a global.
Yeah, some IPLs I noticed they work superficial to deep, and then others work deep to superficial. I like working deep to superficial. I feel like it's kind of depending on skin type, all the same.
Yeah. But this is an example of a beautiful endpoint.
Yeah.
And then the vascular lesions, we can do all of this. So poikiloderma is really common in the South. And I love to use the 580 filter because I do think it is more vascular than, it's more purple than brown.
Yeah.
So I'll start with the 580 and I'll do that in motion technique. And then angiomas, I don't like that it says spider veins because it's not really my go-to for that. Or even port wine stains, I like to use the long pulse for those. So the clinical endpoint with the vascular lesion can either be blanching, so it going away, or darkening. But as long as you see a change, then you should get it. And my rule of thumb is that you get 3 shots. If you can't get it in 3 shots, then you're gonna have to have them come back.
Okay, so 3 is the max that you say for that.
That's what I recommend, because if you're using a VascuTip and you're trying to get a single vein and you're kind of firing it over and over and over, there's only so
Yeah.
much energy the skin can take. So you can adjust up to 3 times, but then after that, I would have them come back in a month.
That's good to know. A lot of what I train on is 2.
Mhm.
only 2 times, but 3 times I feel like is great.
Yeah.
Awesome.
I've not had any issues with 3.
Okay.
Also, the other rule of thumb, which I don't know if I mentioned this yet, anytime you add a vascutip, it is an extra layer for the energy to go through. So I add 1 or 2 joules anytime I attach a vascutip. So
Okay,
if I'm operating at like 16 joules with the rectangle and I need to add the square vascutip, oh, sorry, the square vascutip for the forehead, I'll go up to 17 or 18.
Okay, perfect.
Mhm. Some precautions in pearls with treating vascular lesions. It seems obvious, but I see it happening a lot. Don't put pressure on the vessel, which is hard when the handpiece is, like a little bit heavier, or it's a little bit awkward. You just have to gently lay it on the skin, but you definitely don't want to push in because you will blanch and cut off the blood to the filter or the vessel.
Also, I've noticed too, if I'm treating really cold on the vessels, they respond better if I don't hold it there for a while and kind of make the skin pretty cold, if I kind of just go in, hold, and then leave. So it's still cooling, but not as like
Yeah.
constricting it.
Well, sometimes what I do is I'll fire, but I'll let it linger. I'll count to 3 after. Well, if it's in the nose. If it's anywhere else, no. But this area sucks to
Yeah.
treat.
Yeah, it's
Sorry.
hard.
But it like people don't respond well to that. That is the time where it is a little bit painful. So I tend to let the cooling hang there, but I've not had an issue with not getting it.
Yeah. Okay.
Do not go for vascular lesions overlaid by pigmentary lesions. You always want to treat pigmentary lesions first, and then you will clean up the vascular lesions after. The nice thing about that 540 filter is that it will do both.
Yeah.
And when you look at someone with a lot of sun damage, if you look very closely, you will see broken capillaries and inflammation and diffuse redness in their skin. You will see a huge improvement just by treating globally with the 540 initially, and then you can go in and clean it up after.
Perfect. That's what I do first, pigment. I do put a little bit more pressure on that to blanch the vessel so I can focus more on the pigment and then go back in and treat.
And then we don't like to use this on legs because of the depth of the lesions, and then legs tend to see a little bit more sun. So I tend to think that it's a little bit more of a complicated area. Fluence and pulse time must be adjusted according to the caliber of the vessel. So if the vessel's pink or red, you really want to shorten that pulse width and increase your fluence. If it's blue or purple, and I have seen them on the face, I've seen reticular veins on the face, superficial, but a larger diameter, then you don't necessarily need to shorten that pulse width down so much. So as long as the chromophore is obvious, you don't have to adjust too much. But if it is that thin little red line, then you will have to help focus the IPL into what it needs to see. I also am not a big proponent for numbing.
Yeah.
Yeah, because it can flush the skin, and I think that IPL can get lost if there's erythema in the skin before you even start. So I don't know.
Yeah, I don't either.
We do have our Siberian cooler, and sometimes, especially for providers that maybe have had a bad experience with IPL, they'll use both. They'll have like the chiller blowing on someone's face, and they'll use the contact cooling, just in case someone's, having an issue with discomfort or fear if they've ever been burned before. This isn't the best example of poikiloderma, but it is. I mean, you can see that diffuse redness in the chest. And again, I just think the 580 is fine. I don't think it's necessary to use the 640 or 695. I think the 580 does a beautiful job, or the 540. And again, this is like a clinical endpoint, so it's going to look worse before it gets better. Oh, sorry. Hair removal, it can be used for Fitzpatrick's 1 through 4 if you use that 695 filter. It can be used on fine hair, and it does have that sapphire cooling system. IPL in a pinch, like some upper lip hairs, chin hairs, and even, armpit, I think can be fine to use for IPL. But everything else, I would use your long pulse or Alexandrite. And then your clinical endpoint for hair removal is the perifollicular edema, and some uniform erythema and carbonization of the hair follicles.
You use stack for hair removal too?
In
Like,
terms of like
Sometimes
wavelengths?
I'll do a 695 and then a 640.
Um,
to kind of get
I think, yes,
Okay.
there are times if I stack if I'm not quite getting the
that?
end point,
Okay.
but I generally don't have too much of a hard time with it.
Cool.
Can be used to treat acne vulgaris, so pustular inflammatory acne. That 400 wavelength is really nice, and you can layer that with the Pro Deep. And I've done this, I've done like backs of like teenagers who play sports and they have that mechanical acne. It's really nice. But again, our Pro Deep, I kind of favor the Pro Deep. It's a little
Okay.
bit faster, so.
That's what I have our acne patient for today for the Pro Deep.
Oh, nice. This is the same video. I don't know why it's twice. Okay, so contraindications, of course, like skin typing, tan, pregnancy, lactation, like all the obvious ones. Anybody that's on antibiotics, or has sensitivity to light. Hair removal, and this goes for any of our lasers, it needs to be short, like shaved within a day, but not tweezed or waxed. And we say no sun exposure for 30 days before and after a session. That's not always realistic, please. So like 2 weeks before and after is a little bit more realistic. We don't want to overlap shots, but we do not want gaps. So I would say like a 10% overlap at max. Sunscreen should be applied immediately after any treatment, preferably a physical. I don't let people leave without covering them in sunscreen after a treatment. And then it takes about 2 weeks for that, and they're not scabs, but the peeling to happen, and can sometimes take up to 2 weeks for that to exfoliate off. Okay. So if you can use dynamics mode, Vi's pretty much saying like use it because it's really safe and it does work. There's this really cool website called mypracticevydence.com. It is providers from literally all over the world, doctors, NPs, estheticians, and they are showcasing their results and they don't gatekeep. So they say, this is my before and after, and this is exactly the protocol that I use, down to what handpiece, their settings. They'll even tell you if they were on topicals or systemic medications. They'll tell you their exact protocol. And I just think that's so valuable to know what other people in the world are doing, because there are certain countries that are, I think, a little bit more ahead of us, or a little bit more aggressive, or a little bit more open to layering energy versus, I think the US has a little bit of catching up to do.
Yeah.
So if you ever want to be inspired or just see what other doctors are doing, like in France or Brazil or in Germany, you can go on this
That's
website.
awesome.
There are no consumables in any of the Vydence catalog. So that just means you have to take care of it. And we use isopropyl alcohol to disinfect after each patient. And especially if you do use gel, you're going to want to clean that as soon as you can. And just make sure the filters, when you switch out those filters, you're not touching the actual filter, you're touching the little plastic piece that's attached to it, or you are using gloves. And if there is any sort of smudges, you can use a microfiber cloth to go ahead and remove with a little bit of alcohol. If there's ever like a burn mark in any of them, then you would have to get them replaced.
We typically say if it's opaque and larger than the larger than the size of a pencil eraser, I think that's what we say.
To get it replaced.
Yeah.
Okay, so I think that's all of the IPL didactic. Is there a way to see if there's questions?
I checked the chat. It doesn't look like there are questions yet
Okay.
from what I see.
And anybody who's watching, I love questions and I'm not afraid to put it out there. Okay, so if there's not any questions, we'll go through the Pico. So sorry, this is a little redundant here. This Pico is probably one of my, I'm going to say this about all of them, but I really love the Pico. I love that you have all of the Pico capabilities in a handpiece, because I've seen so many Picos that are just huge and they take up the majority of the room. I don't love working with articulated arms either. I just feel restricted. With this Pico, you don't have that. And it is a dual wavelength Pico. So we have the 1064 as well as the 532 nanometer wavelength. The 1064 has that high affinity for melanin, but as you can see, the 532 has a much higher affinity for melanin. So that's all of your sunset colors or your low contrast litigines, versus the 1064 is for literally any kind of pigment and any skin type.
Do you think in the future there might be like a 585, 695?
I don't know
Okay.
with the Pico, but what I have found is that I've gotten frosting on orange, even with the 1064.
Okay.
Um, I have not run into an issue yet, with certain colors. If you look at like the 795s, like their chromophore, what they're attracted to is like the purple and the dark blues, which is very similar to what a 1064 is attracted to. I know red and teal could be a little bit of a problem, but so far I haven't run into that issue. Um, and then some people are using erbium if there's that
Mhm.
little bit of pigment left over, like a mechanical way of getting
Yeah.
that pigment out.
Cosmetic ink?
Mhm.
Pretty good with cosmetic ink,
Mhm.
that
Very
oxidizing?
good.
Okay.
Yeah. So we have this provider in Florida. Her name's Chelsea Vaca. I just did a webinar with her because she has like become the tattoo removal queen. She got a Pico in her practice, not really knowing what to expect, and then she has carved out quite a niche of tattoo removal. And her before and afters of all of her eyebrows, her lips, and then of course just regular tattoos anywhere on the body and even on the face. Like she's got some incredible before and afters, and she's only been using our Pico.
Wow.
This is where I like nerd out a little bit because I just think there's something really cool about taking a wavelength like 1064 and by just manipulating the pulse width, you are completely changing how it interacts with the tissue. And so when you have a millisecond, which is considered a long pulse, or a microsecond pulse, it's still going to be photothermal, whether it's, intense photothermal or it's going to be more of an accumulation of energy, it's still going to result in heat. And then I don't think a lot of providers that you're going to go out and train don't even understand how fast a nanosecond or picosecond is. So I love this little table to show people, it's a billionth of a second and a trillionth of a second is what you're working with here. And now we're going to go more photomechanical, as opposed to photothermal. And this chart is kind of showing the transition from photothermal to photoacoustic. And you can see that like nanosecond, it's not as photoacoustic as picosecond. There's still going to be some thermal interaction there. So there's still going to be a little bit of heat generated in the tissue, which is why I like to use nanosecond sometimes. If I've got a really saturated tattoo, a really dark tattoo, or I have some stubborn pigment, having that capability of being a little bit more aggressive with the nanosecond pulse is really nice, but the picosecond is just so much more refined and safer. So if you are treating a darker skin type, if you're treating melasma, that's the pulse width I run with. And then this is a good visualization about like why nanosecond or why picosecond. Nanosecond can kind of break up a solid piece of ink and make it into little pebbles, where picosecond will then take those pebbles and make it into sand. And so that's a good explanation because some providers are like, when do I use what? Or do I ever use nanosecond? And I just said, well, it's provider preference. I do have providers that never hit the nanosecond button. They just run with picosecond. But I think there's something to be said if someone has a really saturated dark tattoo to kind of breaking it up a little bit before you then break it up even more. So I think it helps get the process started. And nanosecond tends to be a little bit, again, more aggressive. And there are some studies that say that if you're a little bit more aggressive in the beginning of tattoo removal, then you tend to have a better result and get there a little bit quicker. So the mechanism of action for the pigment removal system is called phagocytosis, and that's when that fragmented chromophore gets enveloped by our little macrophages, which is our part of our immune system, and those macrophages carry them to our lymphatic system. And so essentially it's going through our lymphatic system and we eliminate it from our body. For this reason, there's not really studies solid studies on risks with this. But this is why I say, you know, we don't want to overwhelm anyone's lymphatic system. So I recommend not doing very large tattoos all in one session. I tend to stay the size of my hand.
Okay, I do 2 postcards together.
Two
That's what I
postcards?
do.
Yeah. And this is just a good visual representation of that disruption. It almost is like a shock wave of energy that breaks pigment apart. And then you can kind of see our little macrophages attacking it. And then it's all going to happen underneath the skin, which is nice. So you're not going to see, I mean, you do see scabbing with tattoo removal when you have to get more aggressive. But initially, it's just frosting, a little bit of blistering. Yeah. Not too much, but a little bit. We have 5 collimated spot sizes, and we do have 1 fractionated. And I love this tip.
Yeah, I love the fractionated tip on any Pico or Q-switch.
So we call it our 6x6 MLA optical element tip, and we'll get into a little bit of the science behind that one. But I think we are getting into it right now, actually. So the MLA stands for micro lens array. It's 280 microthermal zones per centimeter squared with top hat profile and high precision of energy. So ultra short pulse width, very high output of energy with those spaces in between those microthermal zones. And it is the nice thing about our system, it's picosecond or nanosecond. You don't have to manipulate from there. So, but if you choose picosecond, it is specifically 530 picoseconds. So this is just showing like that top hat profile of energy. And when this is happening, it is going to lead to the ionization of the cells and plasma formation in the papillary derm. So there's going to be these little LIOBs that start to form, and LIOB stands for laser-induced optical breakdown. So we call this a photoionization effect. Essentially, those LIOBs look like little bubbles. And again, they land in the papillary dermis, so right at the DEJ, and some are going to be in the epidermis, some might be in the superficial dermis, but that's a great place to stimulate neocollagenesis. So these little bubbles form, and after about 24 hours, they scab and break open, and it is just like a wound anywhere else. The body will respond just like any other trauma with neocollagenesis. And this is a good visual of, again, what's happening. So all of this energy, it's causing all these electrons to kind of move around quickly and collide with each other, which is what helps form that plasma ball. And then after that, you see the little bubbles or the little LIOBs, again, right at that DEJ, which I love. And at the same time, it's still using that photoacoustic energy to disrupt pigment. So this is something that I layer. If I'm treating melasma, my melasma protocol is always the 7 millimeter collimated tip first. And then I layer with the fractionated, the MLA tip on the melasma only. Because it's working in that papillary dermis, I know melasma is a vascular issue as well, or an inflammatory issue. And I think this is a good place to kind of stimulate some collagen to help the melasma with that component of it, as well as the obvious of helping disrupt the pigment. I've even seen people use the fractionated for tattoo removal.
Yeah,
For like
I've tried it
a
before.
little, that when it's really faded, like a black tattoo and it's like gray, I've seen it work really, really well. And this is a histology of a LIOB and what it looks like 10 minutes after a treatment versus a day later. And this is showing that we can stimulate LIOBs compared to other standalone devices. We're comparable. The depth and the size as well. I think a lot of people want to say because it's a handpiece and not a big system that it's not as powerful, but not having to travel through an articulated arm and having all the energy only needing to go about 2 to 3 inches before it hits tissue makes it so we're just as powerful.
Yeah, that makes sense.
So this is more of the technical characteristics. So it's an ND-YAG 1064, the KTP attachment for the 532 nanometer wavelength. Maximum energy is 500 millijoules. Not that you'll ever see that. Pulse width is either 530 picoseconds or 2.5 nanoseconds, and can go up to 10 hertz, which is very important when you are doing that accumulative energy technique, because it is a little heavier. You're gonna get very toned arms when using the
Yeah.
Pico. There are 4 spot sizes for the 1064 wavelength, 3 are collimated, and the 1 is that fractionated tip. And then there are 2 spot sizes for the 532. So there's no warm-up time, it's portable, no articulated arm, and no consumables, and 6 spots that come in your kit. It's great for rejuvenation in all skin types. It's great for pigmented lesions and tattoo removal. And then they call it picotoning peeling. I just call it picotoning because there's no peeling involved. And I think it's a little misleading. But it's a great treatment for acne scars as well. Okay, so this is kind of going through each tip and what it's for. The 6x6 is for rejuvenation and acne scars. The 7mm collimated, that's your pico toning. This is what you could use on your Fitzpatrick's 5s, 4, 5s, and 6s really easily. This is what I use to treat for melasma. It's very safe. It's very comfortable. It is a little loud. You can hear some snapping, but it's not hot or uncomfortable. The 1064 3 and 5mm that's more for a spot treating technique. Versus the 7mm is always going to be in motion, and the fractionated is always in motion as well. The same techniques there. The 5mm you can do in motion at the lower fluence. Say your 7mm is plateauing a little bit and you need a little bit more aggressive to treat a global pigmented situation like melasma or really bad sun damage. You can use the 5, but you have to keep it on a lower fluence. But primarily the 3 and the 5 is for spot treating lesions or tattoo removal that are for darker tattoos. Then the 532, you have a 3 and 5mm spot size. That's for your light tattoos and your light pigmented lesions. So your low contrast stuff and your sunset color tattoos. As you know, the smaller in diameter the tip, the more aggressive it is. My catchphrase for Pico is graduation to aggression. Don't graduate to the smaller spot size unless you max out the spot size prior to it. Don't ever assume. Like I said, I've gotten frosting with a 1064 tip on orange before, and I tend to try to let the skin tell me what it needs versus me just guessing and trying and being overly aggressive for no reason. You do have to connect that KTP module on the 3 and the 5 spot size for the 532 wavelength. Vydence just saved a little bit of money making 1 instead of 2. So you just have to, remove and screw into the whatever tip that you're needing to use at the time. And it's very simple. People forget and they've called me and been like, it's not working, or it's like just falling out of the Pico, and you're like, oh yeah, you have to attach that base. You don't need to see how to do it twice. The interface is a little bit simpler because, like I said, you don't have to manipulate pulse width. It's either picosecond or nanosecond. So you just press that button in the top to switch it back and forth between nanosecond and picosecond. But in the top left, it will always say hand pico, what wavelength you're in, and the top right will say what spot size you're using. The left is your fluence or your energy, and then on the right is always going to be your frequency or repetition rate. This is where the counter is really important because you need to be able to see how many shots are accumulating in the skin. Same thing for the Xi, very similar. Clinical reference guide for Pico is a lot easier to read, I think. A little bit more simple, and the indications are broken up a little bit. And they're very specific, and they give you a good range. And again, just test. If there's one piece of advice with Pico, is always fire a test spot. Okay. So we're going to kind of go back to talking about the fractionated pico. A lot of people say like, well, when do I use that? What is it really for? And I think it's cool that you can have a treatment for someone with melasma for rejuvenation and it's safe. There's a lot of people that don't have this capability, so the only treatment they have for melasma patients are chemical peels or mechanical microneedling, which still can get hot in the skin and disrupt and create a worsening melasma situation. But melasma patients have fine lines and wrinkles. They have acne scars. They have enlarged pores. They have texture. And so this is a great way to be able to give them that rejuvenation effect. Or if just someone, doesn't have an ablative or non-ablative handpiece and you want to stimulate collagen. This is an example for a light fractionated treatment. Very, very, very light. So you control the intensity of a fractionated pico treatment, and it's based on their skin type, your energy level, and your number of shots and how many passes you're essentially doing. But this is something that you can do with almost no downtime, just a little bit of erythema. And you can see how it just brightens her skin. That muddied appearance around her mouth is brightened. Her skin is smoothed out a little bit, and you even see a slight tightening on the jawline. But this is basically no downtime. And it's stimulating collagen and addressing some pigment. You can do this around the eyes as well for dark circles and some fine lines. It does look a little bit more like purpura when you're around the eyes, just because the skin is so thin, and on the neck too. What does downtime look like for a fractionated pico? And it's petechiae. And the level of petechiae can vary, again, based on your energy settings and how many passes or how many shots. But the petechiae is your clinical endpoint. You need to see that. Having a light microfractional picotoning is what they call a lighter treatment. That could be about 3 days of petechiae and a little bit of erythema in the skin. But you can do more intense. So this is a full face example. So 1.5 millijoules, I don't go below this. The range is 1 to 3 millijoules. I've never gone below 1.5. I tend to stay at 1.5 or 1.75 for a microfractional treatment. And it's about anywhere from 500 to 2,000 shots per quadrant of the face. And this particular patient had 4,000 shots, so about 1,000 shots per quadrant. And you can see immediately after, she's uniformly red with a little bit more intensity of purpura around the eyes. And literally 1 hour later, the erythema will dissipate and you'll just be left with the petechiae. Day 1, most petechiae on the lower face is gone. It's going to linger around the eyes. Day 2, and by day 3, it's pretty much fully healed. Definitely can cover with like a tinted sunscreen at that point. But it's not going to crust, it's not going to scab, it's not going to peel. So the downtime to me is a little bit more desirable if there's going to be downtime. Now, if you have someone like this who comes in and they don't want to do resurfacing and they don't want to have the downtime of like a CO2 or an erbium, this is also a good option for them. And this particular individual, they did layer different pico tips. So they used the 532 on some of those seborrheic keratosis on her face, and then did a global treatment of the MLA. And you can see the before and after. For this individual. So the fluence was between 2 and 3, and she did quite a few shots. I would imagine over 4,000 shots. You can still do this multiple times. You can do this every 30 days, and you could do, 3 once a month for 3 months and get incredible results. But I think this is a really great result for just having one treatment with downtime, but maybe not the downtime that we're used to seeing. So we call it intense pico when it is that higher fluence and more shots. And this is what you can expect. So you're going to have moderate to intense erythema. You're going to have more purpura versus just petechiae. And you're even going to see some edema. The heat and burning sensation is kind of like immediately after, but it's not the same as like a true photothermal laser. Edema can last about 24 to 48 hours. Erythema will definitely last anywhere from 24 to 72 hours. Itching is common. and I say don't put them on any kind of steroid until at least day 3 if they need it, but by day 3 that should really go down. And then the petechiae and purpura can last up to 7 days. This is an example of intense pico. This tends to scare some
Yeah,
people.
I've never seen it like this.
I definitely have, and this is very common in Asia or Brazil. They tend to be very aggressive with their fractionated pico. And even though this is scary, this is very normal. And you can see by day 5, I mean, definitely coverable with makeup or even a tinted at that point. She probably has another 2 or 3 days to go before fully healed. But the worst of it is 24 hours. After 24 hours, it gets significantly better each day. So fluence obviously is going to affect your treatment, but number of shots, are you combining this with anything else? Are you stacking this? And then what is their phototype and what is their capillary fragility and the thickness of their skin and how sensitive is their skin? All of these factor into the intensity of the treatment. But you test with anything. I test the skin. So you are going to find a line on someone's jawline. You can hear the snapping. You're also going to hear beeping, and you're going to go back and forth on the same line about 3 to 4 times. And then you're going to wait. And about 10 seconds after you're done, you'll start to see it turning pinky red. And then about 45 seconds to a minute, you will see petechiae. If you see that, and it looks like this, and that's kind of where you want to land in terms of, how aggressive you want to be, then great, proceed with your treatment. And if it took 3 to 4 passes to get that even level of purpura or petechiae, then that's probably what you're going to need to do for the full face. And it's that pace that we saw that it's almost like painting. So it's not necessarily slow, but it's controlled. And this is an example of microfractional pico toning or intense pico in all of your different skin types. So all of this is okay, it's normal, but you can see when someone has thicker skin, it looks like a mild sunburn for the microfractional pico toning. But if you have a FITS 1 and they're older and their skin's a little bit thinner, it's still gonna look a little bit more intense. This is also an opportunity to learn about gaps. There are so many pictures in here where I see gaps. I always crosshatch. So if I'm doing one pass vertical, the next pass is always horizontal. Patients see gaps and they get upset. So like why they didn't do that woman's upper lip, the FITS 1 for the microfractional, I have no idea. And then the FITS 4 on the bottom, you can see very visible gaps between the rows. So that would drive me nuts as a clinician, but it's something for you to kind of see and notice and be aware of before you do a treatment.
50% overlap?
I mean, it's more like you're crosshatching, so I would say about 20% overlap and then crosshatch. Adverse effects, which as you can see aren't that bad. So someone can actually pinpoint bleed. That tends to happen when you're being way too aggressive. You can heal from that though. Ecchymosis, so just more purpura in the eyes, around the eyes. But again, that can heal, just takes longer. Papules, that is something that is a little bit more common. I find that with when you're using the MLA to treat melasma patients, you have to be very aware to not put any thick or clogging makeup, moisturizer, anything on the skin, even though it's not ablative. The skin almost behaves like it is. So if they did, and melasma patients are used to caking on makeup because they want to cover their melasma. And so they have to really make sure that they understand they can't do that. But I've had people do it anyways, and they'll call and say that they have these papules. The papules only last 2 or 3 days and they tend to just go away on their own. But I find that it happens when someone uses a clogging moisturizer or puts makeup on too soon. So I say don't do makeup of any kind or thick moisturizer for at least 72 hours. And then crust, which are scabs, this is also coming from Brazil. But that can happen. It's a punctual scab when using the 532 wavelength, whether it's for tattoo removal or for treating, an SK or a Lentigo, spot treating. It will scab up a little bit. So just scab protocol, keep it moistened with Aquaphor Vaseline and do not pick at it. Okay. We're almost there, guys. I know it's a lot. So this is an example of parameters for someone with melasma. So starting with the 7mm collimated, anywhere from 0.6 to 1 joule for fluence, 10 hertz, anywhere from 4,000 to 8,000 shots. I at least want you to get 2,000 shots, so 500 per quadrant. And my clinical endpoint for melasma is erythema. If I start to see any erythema, then I know that there is some heat building in the tissue. Even though it's mechanical or photoacoustic, it doesn't mean that there's no heat. There's sometimes some. And so you have to be aware. And if you're starting to see the skin turn pink or red, then you need to stop for melasma. If it's just sun damage, then just get the shots in. But I'd rather you get more shots at the appropriate fluence than have a fluence that's too high and then have to stop after like 200 shots. I think that that's not as an effective treatment. And then this is so gentle that you could do this weekly. Not everyone can make that work, so biweekly or monthly is still acceptable. This is a low and slow treatment. This takes 6 to 8 sessions, but it is your safest way of removing pigment from any type of skin type or indication. And especially with PIH, if someone's been burned before, the last thing that they want is something that's also hot or intense or has downtime. So, because not only is there physical trauma to the tissues, sometimes there could be emotional trauma that goes along with that. So I find that the Pico and this one, they don't mind having a few extra sessions because it doesn't hurt and it's not hot. So your dark pigmented lesions are always going to be your 7mm, your 5mm. Your low contrast is going to be your 532, 5 and 3. Just be aware that whenever you use the 532, it's always punctual. It's never in motion. The endpoint is going to be frost or erythema or darkening of the lesion. If nothing happens when you do when you fire it and you don't hear a snap, then you need to change your fluence. If someone has acne scars like this, you can use the MLA for that. You're going to have to do the intense. But honestly, if I saw someone like this, I would recommend my Pro Deep instead. But it's nice because not everyone's going to have a Pro Deep. So if they have just a Pico, like say you have a clinic and they just wanted a Pico, you have the ability and the capability to do skin rejuvenation instead of just doing pigment and tattoo removal. So 532 cannot be used in phototypes 4, 5, or 6 ever under any circumstance. Only the 1064. And the way you kind of remember that is 532 is 3 numbers, so fits 1 through 3. The skin should always be clean and dry. Hair can break or lighten. Break at the surface. It's not going to affect the root like a long pulse 1064. So you're not going to remove anyone's hair if you accidentally, get into an eyebrow or a hairline. But it can also lighten hair temporarily.
Yeah, I've heard of that hair bleaching.
Yeah.
I'm learning about it now.
Most people aren't mad at it,
Mhm.
especially if it's like, kind of sideburn area or peach fuzz. They're not upset that we lighten their hair there. They don't want you to do that to their eyebrows necessarily. However, if you're doing tattoo removal for eyebrows, you can use those gel patches. There's a company called Innovative Optics
Yeah.
that make them. You can fire the Pico through them and it will help preserve the hair, not bleach it or break it. Or you can just use an eyebrow brush and try to brush as much out of the way as possible. Post-procedure, we don't necessarily want you to apply a steroid because we want inflammation to signal for the neocollagenesis. But if it's to the point where it's day 3 and someone's miserable, as long as you can wait to 72 hours, then it's fine. I always laugh at this because this is like the worst example of tattoo removal. But, for, I'll humor you guys. If someone were to come in with this and want removal, you would definitely have to do this in stages. Like Kiki said, about 1 to 2 postcards in terms of size. And you're gonna have to tackle darker colors to lighter colors. So always darker colors first, frost those, and then you're just gonna have to change your settings or tips as you go along to treat the lighter colors.
And do you say 1064 for the first 4 or 5 treatments before you individually treat the color because the color ink still has black ink in it?
So it just depends. Like there are some spots where, I mean, I think the color here is very dark. You would only need the 1064, but I would go down to like the 3
Yeah.
for some of the colors and be more aggressive. But yeah, I wouldn't go for the 532. It takes a while, I think, for me to need the 532. 1064 is very powerful, and I tend to get the first few sessions, I only need the 1064, unless it's like those smaller and just very light tattoos to begin with. So this is kind of saying like that third wavelength, what it's known to help treat, the strengths and weaknesses behind those wavelengths. The increased effectiveness and efficiency of tattoo removal from nanosecond to picosecond, which we kind of touched on in the beginning of the slide deck. Same thing. Sorry, guys, it gets a little redundant. This is recommending the 1064 5 and 3 millimeter spot size to treat this. Frosting is ideal, but it's not necessarily restrictive, but I need to hear a snap and see frosting in order to know that it's at the clinical endpoint that I need. Number of sessions, it's really hard to say. There's so many factors that and variables that go into that. So I tell people anywhere from like 4 to 14. We have a better idea after the first, 2 to 3, but we really don't know. And minimum interval is 30 days, sometimes 6 weeks. This is where I respectfully disagree. Yes, it is a lighter tattoo, it's smaller, but this is still not something that I would just grab my 532. There are purple, dark green, I even see black in this tattoo, so I would still try, I would use the 3 millimeter 1064 on this, but I would try that first before I came to the conclusion that, okay, maybe then I will need the 532. You would be surprised how much frosting you get with the 1064. And this is why I am pushing this graduation to aggression and not assuming. That top left and the bottom right is something that I've seen a lot in the tattoo removal space. And it's just completely unnecessary. So that blistering, I had this literally happen where I had a woman who I was demoing the Pico on, and she was almost in tears, terrified to do it. And I'd found out that she had 2 other sessions done previously at another clinic, and I couldn't understand why she was so scared. And then I fired at the lowest setting of picosecond with my 1064 5, and I got immediate snap and frosting. And then she had shown me a photo of what they did to her before, and it looked just like that top left, and didn't do anything. Like the pigment was still very saturated. So I don't know what they were doing, but it is very common. So you're gonna have to overcome some of that in the field and just be really reassuring that this is more refined technology, and when it's in the right hands, you don't have situations like this. And then hypopigmentation, again, we need to be patient. I'd rather have more sessions and being really careful, because nobody wants a white outline of the tattoo that they didn't want. The other 2, I have no earthly idea what that is or what caused that, but the top left and the bottom right is something I do see quite a bit. Phototype, tan patients. So if someone's got a leg tat and they're in the sun all the time, then they need to wait till winter time or just not have this done, and they need to keep the area covered. Do not repass. So once an area has frosted, do not go back over it, and then do not stack, which can be hard sometimes if you start to get a little bit more confident and you increase your hertz. You can use this almost like you're coloring. So I call it reverse coloring. But you just have to be cognizant that you're not stacking. So if you get stuck somewhere, then take your foot off the pedal. This is probably the most painful procedure of all the procedures. And so I don't numb for any other procedure.
Oh,
We
you
use
don't.
just our chiller.
Even the Pro D.
Yes.
Okay.
I mean, there are some people that are don't have as much of a pain tolerance, but our Siberian gets very cold.
Okay.
And I have found that I've not needed to numb, I would say 95% of the time.
No, that's fine. We don't have to numb our patient today, but I did give numbing cream to our patient for tattoo today.
Yes, but tattoo removal is the one thing that I say always numb. Always numb and use the chiller.
Dual mode you numb. No, not even for that's okay. Interesting.
I don't. So the thing about erbium, we'll talk a little bit about, it is so precise and it vaporizes tissue so quickly that not a lot of heat and energy generates before vaporization happens. So the procedure itself is very comfortable. And I put the Siberian actually on lower settings.
Interesting.
And it's the afterburn.
Yeah, I
That
was
sucks,
when
but
I got mine, then I burnt for like 2 hours straight.
so I let people sit with the Siberian
Yeah.
on. But yeah, I don't know.
Okay.
Healing agents, topical antibiotics if necessary. You will break skin with Pico once you have to be more aggressive and you start to wander into the 532 territory. You're going to see some bleeding. So sometimes a topical antibiotic ointment if necessary, but I just like Vaseline most of the time. Same thing. Oh, I think we're almost done. So the website, you will see examples of tattoo removal, melasma, rejuvenation, all with the Pico, if you go on this website and look at what other people are doing with it. Preventative maintenance and care. So tip of the trade, or tricks of the trade, only take apart one tip at a time. That was a fun phone call that I got from someone freaking out because they disassembled all their tips and then couldn't remember how to put them back together. So one at a time, but you can completely disassemble them and really get in and clean the lens. Pico lenses are probably the most sensitive and something that you have to be very aware of. If there's a burn on it or a piece of debris or something and you fire it, it's going to put a burn mark. And then the energy is going to focus on that burn mark and not in the tissue. So you're going to notice that your Pico's not functioning to where it should be. I don't recommend doing those carbon peels. Okay, it gets brought up. It was such a fad. I don't really understand them, but it is so risky because if any of that black matter gets on the lens, it will ruin your Pico and it is not under warranty. So I just don't think it's worth risking your lens. 5 million shot pro lamp warranty. All the crystals and mirrors are in the handpieces themselves. So
Okay.
dropping them is a big no-no. It can cause misalignment if you drop them. There are wristbands on every handpiece, so make sure you're wearing your wristband because if it is dropped, it is not covered under warranty to fix, and we know when you drop them. It's pretty obvious, but I've had people try to be like, no, I didn't drop it. Deionized water is recommended, but distilled is fine also.
We have both today, so if we need to fill them up later.
Okay. There's a Vydence Laser Academy. You have access to all these videos, all of our previously recorded webinars. So it's just another tool that you can offer to your providers or for you guys to look back on. That's one thing that Vydence is really good with. They have a lot and that Google Share Drive as well of materials to help you guys out.
That's awesome.
We have case books that I can send you as well, but there's just some cases at the end of each PowerPoint. But I want to show you like a tattoo.
Oh, there's a lot.
There's a lot. So this was only after 4 sessions, and this is light blue. So you can see,
Still use 1064.
and it's only 1064 that's been used on it. Not even the 532 yet. But really good removal. And I think that they stopped or they're showing you this because they wanted to cover it up.
Oh, okay.
But then this one was complete removal. And this was 1064 and 532 that was used in only 7 sessions. This one was only after 4, only 1064 spot size with a 5 millimeter. So they didn't even go to the 3 yet. So there's still a lot of room. to get more aggressive. Sorry, that's a little blurry. They did end up using the 532, but only the 5 mm spot size, so they still have the 3 mm to go in and clean that up if needed. And this is after 8 sessions. I tend to feel like the wrist ones are really hard to remove,
Yeah.
like around the
I'm doing
hands.
one right now.
Are you?
Yeah.
Here's another one. So this was before the Pico came out, they were using the Q switch. And after 10 sessions, got it to that. And then after only one hand Pico.
Wow.
Yeah. And then cosmetic tattoo. So you'll see dual eyebrows a lot in this space. So complete removal after 2 sessions. On the other side, same thing. Yeah. And you can see it didn't make her hair fall out. There's a weird misunderstanding of that. You don't have to shave your eyebrows. You can see that blue, gray wash, and this is only after 2 sessions. So can still go and do a couple more, or at this point, I think can do a cover up if they wanted to. This is the other side. I like this one. It's showing you, it will turn, sometimes it'll go from like gray black to orange, but you can then use your 532 if needed. So again, only after 2 sessions, like a huge improvement. Yeah. And then all of our bibliography. Okay. So I think now is a good time to maybe break and
Yes.
get set up to do some treatments.
Yes, that's perfect. Do you want
Do
to?
I take this off?
I would
Okay.
just mute and turn your camera off.
so you can see the shit is going on. So maybe stand and then I'll kind of watch it. And then push it on. All of, take a break. It's all of. Oh, you want it? There you go. Now twist. Once it takes, you should just twist. And if we want, we can take the pico out because it will hold two hand pieces in it. Okay.
What?
It's not the road. We can try. I think what we should do is do the road to the camera or the iPhone and then unmute that.
Okay.
I don't think we use these. Okay. No. Okay. This is just different.
For dedicating your face to science today. Yeah.
Of course, of course. I'm excited. Robin, where are you coming from, New Zealand?
No, I'm from Florida.
From Florida.
Yeah.
Okay, cool.
Yeah.
What part of Florida?
It's called Ormond Beach. It's on the East Coast in between like St. Augustine and Daytona.
Okay.
So
Yeah.
not as hot
Not
right
as-
now.
Oh, really?
Yeah. But not 40s. It was 45 degrees this morning here.
It's cold.
Is that normal
No, we're definitely getting like a cold front right now.
in
It's
almost July?
yeah,
That's
yeah,
crazy.
yeah. It's always about 10 degrees cooler up here
Mm-hmm.
than it is down in the valley.
Yeah, when I got off the plane yesterday, it wasn't cold. And when I got to the hotel, I was like, oh,
Like,
yeah.
kinda-
Yeah.
Yeah, I was wearing a jacket yesterday, which felt so weird that I was wearing a jacket.
4th of July is literally next weekend.
Yeah, yeah,
It's crazy.
exactly. Have you been doing this for a while?
Yeah. So before Vydence, I was a clinical trainer for advanced dermatology for a few years. And then I've been with Vydence for almost 2 years now.
2 years.
Yeah.
Awesome. How do you like Vydence?
Well, I love the technology. I mean, I also train for like other companies too, and I've worked with other devices, over the years, and it's by far my favorite piece of equipment.
Really? Yeah.
It's the most powerful,
Yeah.
and I just think it's the most customizable.
Yeah.
I mean, I've seen a lot of different multi-platform devices that just don't deliver
Yeah.
power-wise or just efficiency.
Yeah.
I think they've thought about all the things to make everyone's life easier.
That's awesome.
Yeah.
So cool. Are you still doing trainings on the side for other
If you don't,
companies when they call or when they need you?
Yeah, if someone needs help. Yeah, for sure.
Has MRP ever contacted you?
No.
No?
No.
Okay, well, I'll have to introduce you to Stephanie.
Okay.
She's always looking to hire good trainers that
Yeah.
potentially if we sell a customer out in that area, if they're local,
Yeah.
maybe stop in inside or something.
All right. Yeah, no, I created an LLC, so I'm a 1099.
Okay.
Yeah.
Yeah, let me I'll find Stephanie and I'd love to introduce you guys
Sure,
and
yeah.
just wherever it goes from there.
Absolutely, yeah.
Okay,
Yeah.
cool.
No.
they were like, I will send it up.
So what are we like your skin looks pretty great. What are we treating on you?
Yes, we're doing an IPL.
I know, but let me see. Like
So
sorry, you're a little tall.
you tell me. I'm actually very new to this industry. I just started 2 months ago. I
Okay.
come from dental. So
Oh,
this is all new.
skin's new. Okay.
Yeah.
So I mean, you don't have a lot going on, so it should be pretty minimal.
Okay.
So the thing about IPL, it stands for intense pulse light, and it's called that for a reason. It is a very intense burst of light.
Yes.
That seems to throw people off. It's not necessarily uncomfortable or painful. It's more the bright flashing light that causes people to kind of jump a little.
Okay.
So I always warn people, and I will count it down. I'm not going to blind fire on you.
Okay.
But it'll almost feel like where I'm doing something wrong. Because even with like eye shields,
Okay.
you're going to be like, that's obscene.
Okay.
But I promise you, it's normal, and your eyes are very safe and protected.
Okay.
But once you kind of get used to that shock of the brightness of the light, it should be pretty comfortable.
Okay.
You might have that little bit of a sunburn sensitivity feel, not like I'm on fire, but like sensitive to the touch or heat.
Okay.
For a couple hours after. And then if you do have sun damage, like brown spots, they will get darker, and they will stay darker for about 2 weeks.
Right?
2
2
weeks.
weeks. Okay.
Yeah.
Okay.
So true sunspots, they will come to the surface and kind of scatter, and it's not going to scab, but you're going to feel texture to it, and it takes about 1 to 2 weeks for them to exfoliate off.
Okay.
After 7 days, if you want to be a little bit more aggressive with
Okay.
washing your face or like a
Wait, or
towel, yeah, after a week.
after a week.
hmm
Okay.
and then it should come off, but you don't really have a lot of brown. You have more of like a pink, like a red,
Yeah.
diffused redness to your skin,
Yeah.
which also helps with
Yeah.
IPL.
Yeah.
Nothing really happens with that except you might look a little bit more pink initially, like
Okay.
today,
Okay.
and then it should fade within a couple
And then
hours.
just less pink moving forward.
Yes, once it heals. Yeah.
Cool.
And of
Cool.
course, we're going to stay out of your beard line.
Okay.
Do you grow a beard
No,
anywhere else?
not fully,
Okay.
no, just all right here.
Yeah. Okay.
Okay.
And then forehead will be a good one.
Okay.
That tends to have a little damage.
And stay out of the sun for, I was told 3 weeks minimum. Is that the correct
I'm
guidance?
more of a 2 week kind of girl. I mean, I live in Florida, so telling someone to stay out of the sun for 3 to 4 weeks is just kind of like an impossible thing. But I would say the first week is critical.
Okay.
And so it's just a physical sunscreen every day. I mean, you guys aren't necessarily
Yeah.
in that same predicament as the South.
Yeah.
But like a hat,
Okay.
when you're outside, if you're only outside for a couple minutes at a time, like going to your car, a physical sunscreen is fine.
Okay.
But if you're going to be outside for longer than, I would say 30 minutes, then a hat.
Then, like, even more than just a regular hat. Like, would you recommend like a what
Like a
is it?
bucket hat?
Like a bucket hat?
Yeah, ultimately. But for you, I think we're going to focus more on your forehead. So as long as you're wearing a ball cap and it's covering like your forehead and like
So
around your
forehead,
eyes.
like kind of as long as this is always
Yeah.
shaded. I'll be
And you should still wear sunscreen
okay.
every day.
Can I start wearing sunscreen right away? Do I
Yes.
need to wait?
It's not going to ablate your skin at all. So like
Okay.
your barrier is not going to be compromised. So you can put on a sunscreen immediately after.
Okay.
Yeah.
Do I need to be worried about other lights? Like
like
Oh,
photo
yeah.
is
I guess
blonde.
I guess I don't get very many emails from you.
I know. Have I ever emailed you?
Maybe, maybe, I don't know.
Sam, what do you do here?
I am sales operations.
Okay.
Yeah, so I help the team.
So you help find leads
Yeah, exactly. Help find the leads, make sure they're contacting the
and they're
leads,
prepared.
make sure they're prepared, they know what they're doing.
Okay.
Yeah.
That's important.
Yeah, I like to think so.
Kiki, another big seller about Vydence that I absolutely love is that their on switch is towards the top of the device instead of all the way at the bottom. Because I hate having to like bend over in the corner and try to wrestle with it. It's right at the top. So it's a lever right here.
Okay. Perfect.
And then the code is always 0000.
All devices?
All devices.
Okay.
Real easy. This is the home screen. This is where you can remove hand pieces. When it's not in the screen is where you could have a problem. But as long as it's looking like this is technically the home screen, you can detach the IPL. But when you're ready, you hit like the play button. You can hear the water starting to run. Now it's going to ask you to calibrate. So you need to use one of these 3 filters to calibrate. And since he's got a nice mix of browns and reds, I again think the 540 is a great
I'm
wavelength.
gonna do 540, maybe spot treat 515 if needed to.
Yeah.
That's some pretty light ones.
And then maybe 580.
Too, so I was gonna do 585, 540, spot treat 515 if needed.
Yeah, it's pretty diffused though. I don't see any sort of big,
540 might get it a little better.
I think it'll get everything pretty well. Okay. So you just take the cover out and it goes in how you can read it.
Mm.
So, okay. And then, so after I put in the filter, it recognized that it has a filter. Now it's asking me to slide it. So I'll let you do that. Carefully slide it because you don't want to like, oh, sorry.
Oh, it has to fit in the trap.
Yes.
Okay.
You don't want to scrape it too much. So in the tracks and then slide it down. There you go.
Okay.
Okay, now it's thinking. And it's going to ask you to hit the foot pedal once. Oh, sorry.
Just one?
Yep, don't look at it. But yeah.
Oh.
Yeah, you just don't want to be staring at it. So it's measuring to make sure it's treating well. Okay, so whenever any of our devices, whenever you get to like past calibration, you're going to be at the home screen here where there is a guideline mode or an expert mode. Guideline is great for people that are just starting out or just maybe want to get to those suggested settings. So you can hit guideline mode. You can put, I want to do vascular lesions. You're going to pick your Fitzpatrick. So we'll say 2. And then it's going to ask you questions like what kind of vascular lesion, and then it'll spit out your what filter it's recommending and recommended settings. Now, as a clinician, I don't love guideline mode. I think it's a tool, it's great, but I think our clinical judgment is best. And again, what it gives you is not the end all be all. There's still wiggle room there. So I prefer to just be in expert mode and do my test shots.
Perfect. I'm gonna get my laptop that has the settings on there
Oh,
so we can follow those.
I don't use those. No,
You just go off.
just go. Experience.
Yeah.
Yeah.
Yeah. If you could just do the best numbers for me.
No, I plan on fully disfiguring you. No, I'm just kidding. Of course. So if you look at the clinical reference guide, for the 540 filter to treat pigmented lesions and vascular lesions, it's going to be about the same. It's going to be anywhere from like 12 millijoules or 12 joules to 20. That's your over under. And that again is for Fitzpatrick's 1 through 3. You're like a 1-2, I would say.
Yeah.
Two is being generous, but pretty much on
Somewhere,
one.
I'm gonna treat him as a 2.
Yes. But still, when you look at the reference guide, it's a range, right? So that's still not telling you the exact setting. So what I do is a test shot, and I let his skin tell me where I need to land. And I start conservative and then work my way up to where I finally see that clinical endpoint of a little bit of erythema. And you're going to see erythema in like the shape of the rectangle. And then that's where I,
What was that spot size? The 4012 is the original spot size.
yes, for the rectangle. Yeah.
540. Yeah, about 13 to 17, which is pretty standard.
Yeah. So for everything, if it was included vascular, it'd be like up to 20 maybe, but yeah, 13 to 17. So I would start at like 14. And then for pulse width, 20 milliseconds is great for brown. 5-10 is great for vascular. So I like to, again, go in the middle and go to 15. So I operate a lot at 15, but we'll start at 14 and just do a test spot and see how he responds. Cooling is always auto-populated to being at the highest.
The cooling is?
Yes. And then the repetition rate is going to go down to 1 hertz. Okay. Where is the IPL? Oh, it's still in it's calibrated. So always make sure the skin is nice and clean. There's no lotions or sunscreen. I grab some gloves.
They're small. Do you want me to get ones?
Oh, it's fine.
Rest of your hair.
Okay.
He's got a little bit of soap on his nose there. Did you take a photo of him before?
I will, yeah.
Okay. Can I see that? I'm going to take it from this view. Okay.
Okay, I'm gonna have you take a deep breath in and then hold your breath for me. And then let it out through your nose. Okay, we're gonna try without gel. I'm nervous, but oh, hold on, I forgot his stickers for his eyes.
Yeah.
Well, I had everything.
just said she's nervous.
Makes me nervous.
You're in good hands, trust me.
Okay.
I know. So, Brazil, they don't like gel.
No.
Yes. So, all of our 3 out of 4 of our hair removal systems don't require gel.
Okay.
Yeah, they hate it. So
Why is that? Is that because of the science behind it?
I think it's more of like the having a mess to clean up.
Okay.
It's annoying to clean up a full face of gel.
Yeah.
You can use gel. It's just you don't have to.
And the gel, what is gel normally?
It's just it kind of helps with cooling and it helps with glide a little bit.
Okay.
And now when you're doing dynamic mode, which we will need gel for, that is in motion IPL.
Okay.
But when you're just stamping it, you don't need gel.
Okay.
Those are keep your eyes tight. Don't you guys move back a little bit.
And is it okay if I fire?
Sorry, what?
Is it okay if I fire the device? Okay.
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 Nobody's might be on that gel before.
So you can feel how cold it is. So really, really cold, comfortable. So it's gonna be almost like an icy hot sensation. Like icy hot, icy. So it's on standby here. These are the settings I'm gonna start with, and I'm gonna do a couple test spots. He said he doesn't grow a beard back here, so I'm gonna be cognizant of where he does have facial hair. And there's just a few hairs here and there that I'm not too worried about. Do you have a razor though to shave?
I do, yeah.
I didn't see those until I turned you around here. But you really don't really grow back here. Okay.
This also prevents hair from growing too, right? Or
It depends on the wavelength we use.
okay.
This one isn't the most effective, so it's not necessarily going to destroy hair follicles. The deeper ones could potentially.
Can I see the hands?
Yeah. So this is where the filter, you can change the filters. Here, and then if I want to change the pulse width, you press that button and then it can toggle up. Cooling. Just, yeah, I just don't want to accidentally get the spot.
I get it.
No, let me see.
I can't see it.
There, that's it. Okay, so I pick a spot kind of back by the ear and on the jawline. Are your goggles, everyone's goggles on? Okay. So I'm gonna count you down, Sam, okay? So I'm gonna go right here and make a mental note of what it looks like now. And then make sure it's nice and flush with the skin. And then 1, 2, 3. How was that?
Yeah, it's fine.
Good. So then I pull back and then I wait and I kind of look. It's not really reacting. And so I know we're probably going to have to be a little bit more higher with settings because of his Fitzpatrick. So I'm just going to go ahead and jump to like 16 based on like the lack of endpoint there. And I'll go right above that. Do another test shot. 1, 2, 3. Just feel that one a little bit more, Sam, but still not uncomfortable, right? Starting to see a little bit of erythema there. And you can even see a little bit from before, now that it's been some time. So
Once we get into more populated areas of melanin, we might see it too.
yeah, so if I'm already seeing a little bit of erythema in an area that doesn't have a lot going on, then I'm happy with that. So then once I determine that those are my settings, I just go. So I like to go.
The screen for my charting.
Sure. Okay. So I'm gonna go up, 1, 2, 3, and then about a 10% overlap. 1, 2, 3. 1, 2, 3. Because the handpiece is so compact, I can see and get right up to his hairline without.
Do you need a tongue depressor?
No, I got
Okay.
right up there. And you can see now it's starting to turn nice and pink in the area, and it's nice and even.
Looks good.
So then I'm going to line it up right next to
It's
where.
easier to see too without the gel.
Yeah.
And I make them remove it and check.
Oh, yeah. So this is going to make your life a lot easier. And how does this feel for you? Like uncomfortable?
I think the higher you went, the more aggressive it
Felt?
You need a stress ball or anything?
I'm okay.
Okay.
So we'll go underneath here. 1, 2, 3. And I just do little hops, instead of sliding.
Pick in place.
And then once I get close to the eyes, I start to angle it away. So I can get right up to the eye here. And I'm just going to filter it away from the eye. Okay. And then here is where like that square really comes in, because I don't really have enough room for a
Yeah.
full rectangle. But that's okay. We have the square vascutips. So then I'll go in and fill and get closer to his beard line with the square and do his nose and forehead. So I'm going to have you do the other side. Do you want to stand on this side or stand on your side?
I stand right in the middle.
Right in the middle? Okay. So look here. And you can already see, like, looking from side to side, the difference. It's nice and pink, uniform, and some of the spots are starting to darken a little bit compared to this side. Let me go ahead and shave these little bit of hairs.
Line you up real quick, Sam.
Yeah. You're getting you to look spiffy. And the only time I might adjust settings is if someone like drives a lot and their one side of the face
Yeah.
is are you going this way?
I do like
Okay,
to go that way.
That's fine.
How's that feeling, Sam?
Yeah.
Looks good. Some darkening.
I'd say maybe keep your spaces a little tighter. I think you can overlap slightly.
Okay, so
10%.
Okay.
Just watch it. Yeah. And then you can go up here, but just filter, like twist it away from you.
Will you open your mouth, Sam? Perfect.
Okay. All right. And then the little square literally just pops on top magnetically. But anytime you add that extra layer, I'm going to go ahead and go up 2 joules. You go up 1 to 2 joules anytime you add a vascutip. And since he's got a lot more vascular going on up here, I wanted that little extra bit of energy. The only thing you have to be aware of is kind of wait until you feel that get nice and cold. And then maybe take a little bit more time in between pulses. Do you mind if I just clean up this side before I let you do forehead?
yeah.
Just because I have a mental awareness. Like, see, I finished right here. You can see all this
Mm-hmm.
starting to darken. It lays so nicely, and flat.
Yeah, it does.
And then you can get right up against the lip. And then really good for like temples. Okay. You want to do your side?
Yeah. Oh, I want to do a trigger like that.
You could do right on top of the nose too, if you want. Or you can use the round if you feel more comfortable.
I'm just so short. Let me do the round.
Yeah. And temple. So yeah, you can see exactly to be right up against the hairline.
Yeah.
It'll force you to slow down a little bit.
Yeah.
Just because it wants the cooling to. Okay. If you want to finish, you can. Doesn't it look nice? So I'm saying like it's very efficient. I don't need to layer wavelengths a lot because the 540 tends to do a really good job. Every once in a while I need the 580.
Sorry.
No, you're fine.
515, like you wouldn't go in spot treat with the 515. That's my favorite thing to do.
If and only if I see that the 540 is not working, but the 540 always gets them.
Okay. I mean, the small size is nice on the forehead, but I like it pretty fast.
Sure, and you can do the rectangle if you wanted to like do a majority of the forehead,
Yeah.
and then get closer to the hairline.
Or the contours, the sides.
Yeah. And you can see his forehead that had probably the most damage there is starting to react.
Darkened a lot. Right here has.
I think we need to fill in a couple spots just right there. And then sometimes, yeah, I might just, again, take that square because it's a little bit more focus. He had some good reaction here.
I actually think I might hit this.
Yeah. And then I don't have a whole lot on this side. I mean, it's definitely reacted, but it seemed a little bit better. Yeah. If you want to just maybe boom, boom that again because it's starting to react, I just want a little bit more.
Even do that one again.
Yeah. Nice.
Looks good.
It looks great. I think that's it.
Okay.
Was there anything else you want to try
No, I
on
think
him?
that was good. Can I see your chest, Sam?
Sure.
Because you said you have thing on your chest, right?
I don't know. I don't think so.
Okay.
Do we have a
Just
chest
to do
or
we have another one to do the dynamic, but
he's got chest hair though.
Not a lot.
Just do dynamic like right here, just a couple.
These are more SKs. I don't know if they'll really react. I will let you do my arm.
Try it. Okay.
I'll let you do my arm.
Yeah, that's fine.
Yeah. Yeah, so now just a light moisturizer. It's on standby and
Gonna
a
be bright.
sunscreen.
Sorry.
What'd you think of that light?
The light that was shining.
Yeah.
It was really interesting.
It was bright, right?
You like see it through your skull.
Yeah, exactly. Exactly. It's really weird. Should I be moisturizing a lot?
Yeah, I'm gonna
Like-
use to-go cups.
Okay.
Portion cups.
And is this
Post care. Yeah.
kind of like sunscreen? Should I be moisturizing every few hours?
Yeah, these don't feel super tight.
Okay.
I would.
Okay. And that's it.
That's it. Not bad, right?
Yeah, I thought it was gonna be a lot more.
Nope. And the redness is dissipating pretty quickly in your skin.
This doesn't help if you get like if you get really shy and like blood rushes to your face, you look super red. Because this doesn't.
Not really.
It
Yeah.
might help a little bit,
Little bit.
but not like it's just that pigment.
And it'll come back. Yeah. Yeah.
Also,
You trying to hide your nerves? Yeah.
Exactly.
Work on your poker face.
Exactly. I read to like see best results, you need to be doing this often. What is often?
So normally, like if you've never done this, it's done in a series. So like once a month for 3 months.
Okay.
And then theoretically the settings might get a little bit higher each time
Okay.
to get like, it's gonna pull pigment that you don't see yet.
Okay.
So it's gonna get obvious stuff and then it's gonna keep pulling.
Okay.
And then I would say every 6 months for maintenance.
Every 6 months for maintenance,
Mm-hmm.
doing similar.
Yeah, and you might not need to do a series. Depends on your skincare and how like you're taking care of it.
We'll see what I'm doing in 6 months.
Yeah.
Kidding.
Okay. Awesome. Well, thank you so much.
Thank you. Yeah,
Thank
good to meet you.
Okay. Then our last one is not until 12.
So do you want to do my arm real quick?
I can do your
Yeah.
I have gel right here. I'm just gonna close these curtains because
If you want to film it, you can. I don't really care.
if you want to film it, just with dynamic. No. So I'll sit like.
Oh.
Or stand.
I'll stand.
You don't need this one.
Yeah, just do it. Okay.
Wait, why'd you close the curtains?
It's gonna be really bright. So this setting, you're not gonna find a button for this.
Oh yeah, because it's only on this eye, so you have
Yes. So it's gonna be, you gotta lower the joules first to 8,
8 and then 5.
then 5. Then you can increase the hertz to 2.
Okay.
But it doesn't work for other filters necessarily. So the
Only
540
540
on the
filter?
Etheria, yeah.
Okay, I'm just gonna spread this gel.
So I can show you one pass first.
Okay.
And then I'll let you have at it. So I do like a thin layer because too much it prevents it from really being effective. And you pick like 2 rows. So essentially it's going to be like an oblong oval like this. And you just press and hold down. Control your pace. And I tend to start with 3 passes.
Mm-hmm.
Okay. And then you see some spots. You can do that side.
You can already start to see a little bit of, yeah, I live in Florida, so
Yeah.
I've got sun damage on my arms. And you can already see it starting to bubble up. Not bubble up, but like
Mhm.
darken.
Can I?
And you're gonna have
I
scatter.
hold you just like
Yeah,
this.
do it. Slow a little bit. That's better. Slow a little. You're good at transitioning, but transition quick. But when you go the long line, slow down. There you go. See, that's it.
Easier, flatter surfaces.
Yes. So test. What I would do is like vertical, like rows, and then at the end I would cross hatch and go the other way.
Okay.
Sorry, I'm like knocking this all over the place.
Can I see your eye?
And like compared, you can see all the little pigment starting to come up. And you could even do like more.
Yeah.
But that's the technique. And
Oh, that was great. That's pretty simple. I'm just gonna clean up and then I'm gonna take you on a tour
okay.
and then our food will be here by then.
Okay.
Yeah, we don't feed again until 12.
I cleaned the IPL. Oh no, I didn't clean
But
Okay.
maybe this fall we'll
Okay.
reevaluate. and see.
Okay, all right. Let's
You will see a difference after one.
Okay, good.
Yeah. But best results generally take 2 to 3. Yeah.
Okay, great. And then what about moisturizer after?
I'll put moisturizer on you after, and then I'm gonna later today.
Uh-huh.
Are you just gonna be an ops?
Yes.
I'm gonna bring you little to-go containers with instructions. on
Okay. Okay, perfect. All
them. Is
right.
that comfortable for you?
That's great.
Okay. This turn won't go up any higher. Is it moving?
I see it moving.
Yes.
It's very slow.
That's
It's
why I
moving,
feel
though.
fell asleep by everything, so, okay, that's-
And then recovery is a couple weeks.
No.
Okay.
Like for you, you're gonna be pink today, and then it should be pretty much gone tomorrow.
Okay.
If you had brown spots come
Yes.
up, it takes 1 to 2 weeks for those brown spots to
Okay.
exfoliate. But it's not a scab, it's not crusting, it's not peeling, it's nothing like that. It's
Okay.
just they look a little darker, and then one day you'll kind of scratch at it and it'll flake off.
Okay, great.
Oh, it's gonna make you calibrate again. Yeah.
I'm just gonna do a quick.
That freaked me out.
Fourth of July plans or no?
I have a place on the lake in New Hampshire, and so I'm going there with a bunch of people, and I'll wear a hat.
And sunscreen.
Yes. My wife is picking up the mineral sunscreen stuff apparently. So she
good.
used, yeah.
That's good job. Yeah, your skin, you need mineral sunscreen.
Yes. That's what I heard.
Yes.
That's what ChatGPT said.
Oh,
Wow.
I could have told you that too.
I'm a planner.
That's silly.
And
Chat has been surprisingly accurate with the medical advice lately.
Sometimes, yeah, and then
Sometimes,
I'm
yes.
like, oh,
I mean, I take
Yeah.
it with a grain of salt.
my favorite is when providers are. Does my laser treat like one time I had something? Does my Dental Max Pro treat psoriasis? I was like, no. They're like, oh, I checked GPT's settings for it. I was like,
Don't do that.
Don't do that.
So are you gonna do my cheeks and my nose or my forehead?
yep, I'll do cheeks, nose, and forehead.
Okay. And this is just for rosacea, not for wrinkles or anything like that.
No wrinkles, a little bit of your pigment too,
Okay.
but it's really gonna help with your redness, your rosacea.
Yeah. Okay.
So you're a great candidate for that.
Great.
Yeah, he definitely has more here. So, but cheeks and nose, yeah, it's a great area to treat.
Awesome.
Tiny little things they can use the circle tip.
Yes, let's practice with
in
that.
there.
Yes, and then this one, this little cluster here, that would be good to use the
So
circle.
even red, even little tiny capillaries, no gel needs to be used. Guys, I mean, I trust you. I know that's what, but my gut is like, you know what I mean?
Yeah,
Kind of want you to know for sure. No,
It's for sure.
I know for sure. It's just not the norm. So Brazilians don't like gel.
okay.
And so they developed a system and you don't have to use gel. You can.
Your eyes closed.
You can put it on there, but I find that if you use like too much gel, it kind of dulls it.
No, you're right. And nobody really likes to use gel anyway. Like,
Yeah.
they use it because they have to.
And when you said there was a clusters on my cheeks or my forehead or
Cheeks of
Okay.
little broken capillaries.
yeah, I saw those. Yeah.
Yeah.
We're gonna get those too.
Okay.
So those might look a little worse before they get better.
Okay.
So they just might look a little darker.
I use Metro Gel.
Good.
Can I keep doing
When's the
that?
last time you used it?
2 days ago, probably.
I
I-
mean, I think you could use it right after.
I'm not in a rush to use it. I can. It's under control and it's doing as much as it can do. So
Next time I treat you, wait a week
before.
before. Yeah, get off of it for about a week before.
Okay.
Because I could go a little bit more aggressive on
It's
you.
probably been. You know what? It's been a week. It has been a week. I haven't used it since I've been here.
Makes me feel even better.
Okay. So we zap
Do
away.
you notice that it helps a lot or is it kind of minimal?
You know, I've been on it for a couple of years. I used to get breakouts.
Really bad?
Yeah. And
Okay.
it stopped that, which is
Good.
which has been great.
Good.
And I don't want to use it if I don't have to. So I'm gonna use it every once in a while, sort of stage.
Oh no, that's good. As long as it's controlling the
Yeah.
What color are your eyes?
Light brown.
Do you have sunburn?
I don't go in the sun that much. I can. But
I'm not sure you guys are great.
that's a hard question.
That's okay.
I don't lay out. Don't go in the sun.
Yeah,
I think I think he's like a 2-3, especially for rosacea.
three just to start.
Okay.
I'm gonna do 580.
Yep.
I'll probably start 15 joules and I'm gonna do 15 and 15.
Yep.
580.
That's probably one of my favorite settings. So you'll just have to change out the filter. I'll let you do all of this. You good with that?
Yes.
Yeah.
Well, that's great. I'm scared.
No. You'd have to really like try. I've just seen some people really abuse it, like knock it, like
Oh,
throw it in there, like instead of sliding it.
So I get flushing, like my
Other way.
My cheeks look red.
Yeah.
Will this help with that?
It's going to help with diffuse redness and the capillaries.
Okay.
But if you still kind of get nervous and flush,
Yeah.
that can still happen.
Okay. So
But it should reduce it
Okay.
a little bit.
I wanted the little line capillary stuff.
Yes.
yeah, we'll get those.
You got to go up.
Oh.
To 15, right?
Yeah.
15. And full cooling.
I'm gonna do a couple test pulses right here.
I would because he's got beard here, I wouldn't do it down here. Just because we don't want to, if he wants to grow a full beard, I would go above it and like right here above the beard line.
Okay. Are you gonna grow a full beard
No.
in the next like few months?
No.
Okay. All right.
Okay. It's just gonna react a lot more because there's dark hair. So it's gonna react like it's doing something.
I'll scoot right here.
Yeah.
Ooh.
A little spicy.
Yeah.
Let me know if you need a stress ball or
No,
cooling.
I'm good.
Okay.
It definitely reacts more when you see hair. You see how it
Yeah.
kind of melted. So I would just go right above it. And then let's look to see if it's
Horizontal when I do his cheeks that way.
reacting. Was that a little better up there? Or
Yeah.
about the same?
I just smelled burning hair, which is fun.
Mhm.
Breaking a little bit right there.
It's what?
Breaking apart right there, that redness.
Yeah. So I think that's a good setting because he is turning a little red.
Oh yeah, that looks so good.
You should always say that.
And say instead of saying oops.
Well, because it makes you feel better. It's, oh, okay,
Yeah.
it's worth it.
Oh, that looks way good. Okay, I'm gonna get spot reducer.
When you're doing that, are you doing a tiny little dot or is it like spread out?
It's a full 40 by 12 rectangle.
Oh, good.
Yeah. So that whole area that you felt cool,
Yeah.
that's the whole area it's treating.
Okay.
So it's pretty large, especially only had to do a few pulses on each side.
Okay.
Oh, you took out the filter?
Oh. Yeah, I don't know why I did that.
That's okay.
Because typically I do I spot treat with like the 515, so just a habit.
Now you'll have to, because you took the filter out.
Oh, redo the setting.
Yes, but you should go up a little bit.
Yeah, I'm gonna go 17 to start.
Yeah. Good.
So you're seeing that it's working?
Yes. So there's like, for us, it looks really great. For you, it's going to look a little worse because it's going to be more red.
Okay.
But we always look for a clinical endpoint in the skin.
Okay.
So that's where you see a change. So either the skin darkens or gets red, or sometimes the lesions turn purple, or sometimes they blanch. And then that tells us that, that was the appropriate setting. So Kiki's seeing a good clinical endpoint in your skin. I would do the round for his nose just because we need to go up. So when we do the round basket tip, we get quite aggressive with it. So I would spot treat his cheeks with the square, those little clusters. I would just
Not
kind
with
of
the circle.
no, I would do because the cheeks lay flat. I would just kind of treat in this cluster like 4 pulses here, 4 pulses there, and then do his forehead. And then I'll show you like how aggressive I get with the round.
So is this the IRL, like this isn't a laser or is a laser?
IPL.
Yeah.
Not a
It's a
laser.
light.
Oh, it's a light. Okay.
Yep. So we're using visible light. We're passing it through filters. So passing it through filters so that only one wavelength, one light, is delivered into your skin to
Got it.
target each specific thing we're targeting.
Okay.
Okay, now I'm gonna put the vacuum tip on.
Do you want to do his forehead first? Or
I kind of want to do the forehead
with the other one?
Yeah, I kind of want to do cheeks first, and then. Do you want to keep the same filter?
For forehead and for the round?
Yeah, the round.
Yes, yes.
Same. Okay, so I'm gonna put the round one in, and then I'll do his forehead very last.
Okay, I'll show you. I'll kind of get in there.
So in a week or so, my skin's just gonna look less red.
Yes, less red overall. So it's
Okay.
good to kind of take a picture. Like,
I did.
okay, good. And then in about 2 weeks, I would check it again.
Okay.
So here, when I'm doing the round and I've got specific veins, I go up to like 21 and go down to like 10.
Okay.
So I'm just doing these veins. So he's got a nice one
Mm-hmm.
right there. So then I will kind of again make a mental note of what it looks like.
Is it when you
And
say
if you want to take a picture of the lesion.
when you say a vein, is it
It's a
rosacea?
so rosacea, like part of why it looks so red is you have all these broken capillaries or these veins
Yep.
that are very visible.
I see.
So what we're doing is we're heating it up to the point where it'll coagulate
Okay.
and then sink down.
Okay.
So again, like just right over it, lightly touching. 1, 2, 3. And that wasn't quite what I need it to be, so go up to 23. It got a little darker, or a little bit lighter, actually. It's like darker, but then some of this, it was like a
Yeah.
feeder. 1, 2, 3. And that definitely darkened. Now it's purple. So I'm happy with that. And then I'll go in the corner here. Get right in the crevice here. 1, 2, 3. Mhm. And, like these vessels here. Try to get like the feeder part. And that. Oh, that looks nice. Oh, that turned purple.
Yeah, that's great.
If it turns purple, what does that mean? That you coagulated it?
Yeah. So either it will blanch and it'll like go away completely, which that's always really fun,
Mhm.
or it will turn purple. But either way, it kind of will blanch and then go purple again.
Okay.
So either it goes straight to purple or will kind of blanch and then go to purple. You want to do the other side? Let's see. He's got a nice little pop vessel there. And oh, that's a nice one right there.
You guys are catching a lot of things that I don't even see. When you get to you're an old dude, you don't even look at your face anymore, mirror anymore.
Well, that's what our job. We're here to analyze, and
All right.
if you're going to be in the chair, we're going to give you a good treatment.
Do as much as you can.
I would do it one more time. And then I do this little guy right there. Oh yeah, see how it's gone? And then a couple little clusters. And then I think, right, you see that one. Just don't very lightly. Nice. Really good.
Okay, I'm gonna do it.
Fun, right?
Yeah.
I like that one.
The skin feels tighter right now.
So the nice thing about IPL is that it's not necessarily used to stimulate collagen and for wrinkles, but because there is some heat generated, it does have a little bit of a rejuvenation effect.
Okay.
It's not necessarily the one that we grab for it,
Yeah.
but it has a nice byproduct of that.
I'm just gonna try the forehead.
With the large. Yeah, just watch his hair. Yeah, there are some individuals where they're like, especially women that have the hairline that's so short, it's like only 2 inches above their eyebrow,
Yeah.
where this is like impossible. Nice. I would just maybe go into this crevice here.
Do as the temple real quick.
Nice. Okay. Amazing.
I used to have like a age spot above that eyebrow there. I don't know if it's still
It's
there.
gone. I don't see anything.
Okay, good.
Maybe a teeny tiny one.
Oh, the cheeks look great. So of course they're gonna look worse to you, but we're excited about it.
Okay, good.
Um,
I'm gonna take. Oh, sorry. Do you need to get back?
no, I was gonna get back so you can do your thing.
I'm gonna take these off.
Here, I'll get it for you.
Thanks.
Are we done?
I'm gonna put some moisturizer on you and SPF.
Okay.
It's not too torturous, right?
Oh. You're welcome.
That one's great.
So you think it's gonna make it better?
I do. I think you're gonna see it lighten up. You might have to come back
Okay.
next time. Not the next time you come back, but after.
Yeah.
And then kind of look at it.
Okay. But I should see it.
Yeah, you should see it lighten up pretty well.
But like a lot of lasers, it's gonna look a little worse before it gets better.
That's fine.
You're welcome.
And the moisturizer you'll drop off, I can buy.
Yeah,
Is that on? Or
it's just Vandy cream. Vandy cream,
okay.
or you can use serum.
Okay. Moisturizer.
Yeah.
Okay.
Then, but I'll drop you off some as soon as I'm done with treating.
Yeah.
I'll probably make my way up to
That's fair. Okay. Can I open my eyes?
Yes, you're good.
All right.
It's
Oh, okay. Well, thank you so much. That was awesome. I feel.
Look in the mirror.
Okay.
Just because you're a little rosy.
Okay, that's fine. Normally rosy.
Thank you so much.
Okay, that was painless. You guys are the best. Thank you. Kiki,
Yes.
when's your next
One.
one? So
We move to Pico at one.
Okay. Oh, so Pico's at one.
Yep, I have my melasma on Asian skin, and then we'll see his tattoo, and then I have rejuvenation on the 6. Fun. Okay.
Wait, let's do my face instead of my touch.
Well, we can do both.
But the face is gonna be later because we have to do the didactic first.
Face is very last. I sent you an invite. What time it is?
Oh, I don't even remember. I just ours.
So,
It just says, yeah, I'll be there.
oh, you did. Oh.
water. It's just like so that's fine.
Should we pause
And
this?
then you can just
Should we
make sure-
pause this? Just let it.
Yeah.
It's out.
7 minutes.
Oh yeah, we can do that.
We're good, right? Yeah, I can do it 9 years.
Yeah, you don't need this back out.
No,
Okay, I'll go put it away.
it's just mostly your tips and tricks
Yeah.
for the device. And every device is so different.
But yeah, I think we got to treat them for different things. We got rest the emotions. We kind of have a
That was, yeah, like, I use these one Excel emotion ones. Not discussed.
why.
I don't think it delivers enough
Energy.
This one I do think it did a good job with the.
Yeah. Then you
That's
had a
my
couple more
homework.
passes.
That's
But,
Yeah.
just doing it anyway. In packing, I just normally put like the part that plugs into the machine down first. And then spiral around, and I always make sure the cover, like the cover's on IPO, or the whatever cover that goes in the Pico, that's always inserted.
Yeah.
That one.
Oh. Let me get some glasses. Oh, is that good?
Yeah.
Oh, I forgot to do that.
Take some time.
Should we just go up from our other building? I'm gonna go, oh, wait, Pierce, are we still doing your tattoo?
Can we find someone else?
I could try.
Just, oh, wait, keep your mic.
One's on field. Now Pierce's belly. Hey, John Monty's money. Skirt. I think I'm so interested. Hello.
Hi, how are you?
Good.
I'm Stacy. Nice to meet you. I'm Robin.
So Stacy, she works with our trainers. She awards them the jobs. She knows like all of our techs and trainers. So Steph signs on onboards them, and then Stacy actually works with them.
Like a science work. Okay.
Yeah, because all of our field trainers are like Gemini friends.
Okay.
So we just kind of split on these. Obviously, we need to train them on these systems.
Oh, yeah.
So sort of like
Mm-hmm.
sort of.
Especially now, it's so expensive.
Right? Did you travel from Brazil?
Florida.
Florida.
Yeah, I live in Florida.
Nice.
What part? It's called Ormond Beach. It's a little north of Daytona, and in between St. Augustine and Daytona.
I was born in Tampa.
Okay, so other side.
I don't remember it at all.
Yeah.
Hat. Run a hat. Yeah.
Have you ever done a treatment for your skin for melasma or?
No,
Okay.
I haven't. Actually had a CO2 done. Obviously they went pretty light on it,
Yeah.
but luckily there's like no that from it. But I've never like done a treatment specifically.
Okay. So this is our Pico treatment. What to expect on your end is it's going to feel a little tingly, but not like in a painful way at all. It's like a little tingles, and then you're going to hear like auditory snaps.
Like the acoustic.
Yes, the acoustic part. Yeah, and it's not like crazy loud, but you'll hear a little snapping. And with melasma, we tend to go a little bit more conservative. But I'm going to layer it with something like our fractionated Pico on top some of these areas that I know that are a little bit more of a concern, like upper lip and like high cheekbones.
Yeah.
That will cause a little bit of erythema, and you might see a little petechiae, but it's not going to be an intense form of it.
Sounds good. Ready.
Okay, come sit down. I'm so thirsty. IPL, you don't use any gel with their device.
Oh really?
Yeah,
I mean, you do for dynamic,
I know.
but stamping mode, you don't need
Okay.
it.
Yeah. That makes sense.
I know.
Did you do what IPL yet?
Yeah, I did too. I did Sam's Pigment and Mark Kibasa's. What's his last name? Kabasa?
Who?
Kosiba? Mark.
Oh, Kasiba.
Kasiba.
Yeah.
I did his rosacea. It was pretty good.
Nice.
I didn't even have to go down on my pulseration either.
How did you get him?
He emailed me.
That's funny.
He's
Everybody wants a treatment.
Yeah.
You know. Should I take my necklace off?
Well, not everybody. Nah.
That's fine. I can
Well,
stay on the face.
yeah, I'm not gonna do your neck.
Um,
What?
Do you want it in your neck?
no.
Okay.
Yeah, you don't really have anything on there. Your décolleté. It's pretty good. I'm so excited for this.
So this is your first pico treatment?
Yeah. Well, just with this device.
No, I know. That's not. I trust her so much.
Yeah, I'll demonstrate on one side and I'll let her do the other half. Split it down.
That's the only thing. I mean, I do picos all the time. The only thing I'm nervous about is that handpiece is ginormous.
I'll show you some tricks.
So, okay,
Yeah.
that's what I'm more
Well, how
hesitant
do you think
on.
I got one?
No, I know. I'm about to be ripped. Okay,
You have very toned arms.
I'm gonna. Are you wearing any makeup?
No.
Okay, I'm still gonna do a light cleanse. Did you use that soap last night?
I used it this
I
morning.
can tell.
African soaps. Where it's at?
How could you tell?
Every time she uses it, her skin is so
And
glowy.
Mondi
So
told
glowy.
me this morning. She's like, "Your skin looks so good," and it's the. I think it's the soap. I really.
I think so too,
Because
because
you say it every time.
every time
and
you
she
use
says
it.
every time.
All right, I want this soap.
I
It's just
know.
like, they make the soap in Africa,
Mm-hmm.
and I buy it from. There used to be a shop.
Is it yellow?
No, it's brown. It's got
Oh.
like charcoal in it.
Is it that reddish clay brown?
No, it's more like a darker, like chocolate brown, and you
Okay.
can see the chunks of charcoal in there.
Scrub?
I
Is it
bought
a
it-
scrub or no?
No, it doesn't look like I've kept it in my shower before, and if someone uses my shower, like they would be like,
Black specks everywhere.
no, just like the actual soap.
Yeah.
They're like, what is that?
It looks like.
Doesn't look attractive at all. But there's this place in South Carolina that makes it and sells it, and I bought like, I don't know, 2 pounds of it.
What? Do you still have some?
Yeah, I have a ton of it.
Well, I'll buy some just to try.
Oh, let's bring it to me.
Okay. Okay, I'm just gonna alcohol you, and then I'll put your little guys on. Take a deep breath in and hold it for me. Now let it out through your nose. Where did I put it? Okay, I'm gonna put these eye shields on you.
Okay.
Oh, I thought you were still behind me. I was like waiting for you.
Very sneaky.
How long have you been to Vydence?
Almost 2 years.
Nice.
And I went to Brazil to do all my training at headquarters.
Did you have fun there?
No. Like, it was like
Really?
7 days of 10 hours of. I mean, there's like 12 different hand pieces. 3 different bases. I did IT troubleshooting. I mean, they took me out to really nice dinner. I had great food while I was there, but every day was, in clinics, or the doctors were at headquarters. I mean, it was fun for me.
They just didn't allow you much free time.
No, I didn't get any free time.
Yeah, that makes sense. Do you have to go there a lot, or just not one time?
So far, just the one time. There's talks of me going back again. I think next month, maybe. I've been other countries.
So,
That's really cool.
if it were me, I would do a global treatment on her cheeks, and then I would go in and do the fractional on just the melasma up here.
Yeah.
And then her lip as well.
Yeah,
I would probably do a global
forehead.
treatment
She needs
probably
forehead,
everywhere. Yeah.
Too. And I would maybe do a little bit of the MLA kind of down to lower face because it does have that rejuvenation effect.
Yeah.
And I mean, her skin is
pretty flawless, but there's a little bit of texture and enlarged pores.
Mhm.
And then I think as women, we always want a little bit of extra help along the jawline,
Okay.
which it can definitely help there.
Okay. These are my Pico ones, right?
Yes.
Yeah.
Start with the 7mm collimated. The other nice little, it's like a little tiny feature, but there's a little magnet
Oh,
up here,
nice.
so you can put that there and it won't go flying.
Okay. And then does this matter where I?
So you'll insert it, and there's one notch. You'll twist it until you feel it kind of snap into place. There you go.
Yep. Okay.
Yep. And then to remove, you just pull.
Okay.
Here, again, I don't ever
Yeah.
use guideline mode. It's just expert mode. If anything, like you look at the over under and kind of go in the middle. Melasma, we tend to be more on the conservative side.
Mm-hmm.
I don't see any really active flares in melasma. It looks a little bit more like freckling and sun damage.
Maybe a tiny bit.
Upper lip, yeah. So for her, I mean, the 0.6 is the lowest, 1.3 is the highest. And so for melasma, I kind of start around 0.8. If she was a darker Fitzpatrick, then I would go down to the 0.6.
Okay.
And it's always 10 hertz. And I know that sounds fast, but
No.
if you look
yeah.
at the handpiece, you'll know why we do 10 hertz. Okay, gloves. Give me like
And then I have different goggles for you too. They're right here. All the orange ones.
I feel I could technically work on it, but yeah. So here's the counter. And quadrants are like mid cheekbone to ear is the cheek because center face is its own quadrant.
Okay.
So like the inside of the cheeks and the outside of the mouth and the chin and the nose is a quadrant. So then from here to here is more of the quadrant. When you're doing this technique, the tip has to touch the skin. It's not dragging, it's not pushing in, but it's gently gliding on the surface. The more you pull away, it's a focused beam. It will
Mhm.
actually feel more intense. So we want to get as close to the skin as possible. If you kind of lift off a little bit here and there, that's not a big deal. But I like to really make sure our quadrants
Yeah.
are mapped out because from here to here is more flat. Trying to go from ear to the corner of the nose is difficult
Yeah.
to do constantly in motion. So you want to make your surface areas that you're treating as square and as flat as possible. And then foreheads, even though forehead is one quadrant, it is impossible to do the whole forehead at once. So I cut it in half. So if it's 500 shots, I'll do 250 and 250. Cheeks are pretty easy to do, your full count. And then
Full count 500.
yeah,
Okay.
at least 500.
Yeah.
Can go up to 2,000 shots.
We'll
And
just
then
see.
nose, you want to cut in half because you can't go back and forth on a nose. Same thing with upper lip and chin. So you're kind of like doing the math and doing like
Okay.
1 to 200 per side. So I'll show you on this side. So there's two ways of holding this, and always wear your wrist strap because all the crystals
Yeah.
and mirrors are right in this handpiece. So the energy literally is generated here and only traveling about 2 to 3 inches to tissue. So there's no articulated arm, so it's longer, it's flexible. I don't have anything hitting my shoulder when I'm trying to work. So you can hold it. I always use 2 hands to hold this. So kind of like a gun. So one's for holding the weight of it and one's helping guide the flow of where you're going. Or I like holding it like this. So the hose goes over your shoulder, kind of out of your way. This is really good for doing foreheads, and I feel like I have a lot of control and it's not super heavy. When you do the cheeks, this isn't always ideal, so holding it more like a gun is better. And even if someone is older and their skin isn't perfectly like taut, you can do this and kind of hold it once you get a little more comfortable, but as long as you're just kind of gliding over skin, you're fine.
Okay.
Couple features. Once you're ready and you hit fire, it will flash a little bit, but you cannot hit the foot pedal until the green light comes on. That's not firing, it's just the flash. Now that the green light is on, the screen is ready, you can fire. This will automatically shut off after about 15 seconds. So if I stood here and talked while this was flashing, it would just shut off. It's not broken.
It looks like 10 hertz too.
Oh yeah, it is. It's very fast.
Yeah. But does it do that even if your hertz were lower? Is it that fast?
You know, I've never gone slower. So 25 hertz. I always just do 10.
Yeah.
No, it's
No,
the same.
still the same. Okay.
So I kind of try to get in position while it's flashing and kind of doing that 5-second warm up. And then you're good to go. And again, just like IPL in motion, even though it's flashing and beeping rapidly, you really have to be intentional about your pace. And this is where I would stop. And now I'm going to come immediately back and do my horizontal passes. And this, not necessarily overlapping, but when you crosshatch, you should fill in any gaps.
How does that feel, Stace?
Fine.
Do you have any sensation that you're feeling?
Maybe like a tad bit of heat, but
I noticed
might
I
like
just,
hit, yeah, kind of like
a little tingle.
a little tingle, yeah.
Notice I immediately just flow right into my next pass. Even with the goggles on, you can kind of start to see when the skin's starting to turn a little bit of pink. So I'm gonna just focus a little bit more under the eye. And then if you look for skin that has a nice light hue of erythema where we treat it, and that's your perfect endpoint. And it was 852 shots. So we landed right between 500 to 1,000 shots, which is perfect.
Can we reset it for the next quadrant or no?
You could, but I kind of just like to add, because then you kind of have to make a mental note of every single time. And it's not like if you go over, if you do 900 on the other side, it's not a huge difference. Yeah. So then I'll show you the whole half of the face. I'll do nose, upper lip, and show you kind of the technique for that forehead. So nose kind of goes out to here. And again, I'm just gliding over, nice and controlled. That one's about another 200 to 300. And then upper lip, which tends to be a problem spot for a lot of patients with melasma. So as long as you're just flowing constantly, I like to still crosshatch even though it's not a big space. You can see it's a little pink compared to this side.
Yeah.
And then stop. And then she doesn't have a whole lot in chin. It's the same thing. Okay. And then forehead is where I change my positioning to be like this. I just feel like I have a little bit more control. And if it's too difficult to go down to the temple, I'll save it. So again, keeping your surface area as flat and as square as possible will help you with your passes. It always depends, like some patients sit, they don't have a bed that lays down, so. If anything ever feels unnatural or like awkward, then don't do it. Just wait. I like how these spots are starting to come out.
Mm-hmm.
And then I'll switch back to do the temple area. Let's just kind of fill in what I didn't get. And then she doesn't have it, but if you had someone with dark circles and they had those metal shields, you can always go here, lift up, and then go this way, and then pull skin down and stay on the orbital rim. And just kind of go back and forth like 4 times, and then that should be enough to give you a nice pass.
Cool.
So that was 2,300 shots. Like I said, you can go from anywhere from 4,000 to 8,000 shots. Typically, you want a minimum of 2,000 absolute minimum, average of 4.
Half face.
Mhm.
Yeah.
So, oh no, total. Like, so if someone's really sensitive, you want at least 500 shots per quadrant. But if you can get 1,000, that's better.
Okay.
And you can see like just a little pink,
Yeah.
not too bad. And you can really see it starting to develop here.
Yeah.
This is amazing to do on someone's chest, especially if they've done a few IPLs and it's just kind of plateaued. If you did this over a chest, you would see so much pigment get drawn out. All right, you're gonna do the other side.
I'm gonna turn you this way. I'm gonna get the.
The other side's a little bit worse in terms of discoloration on the cheek, so you might spend a little bit more time.
Can you toss me the foot pedal?
Do you want me to move?
I think I'm gonna work over here.
Okay.
Thank you. And then can you put it in ready for me? Stuff right here.
A little slower. There you go. Perfect. And then start going horizontal. A little slower. Let's put a little extra tip up there. You just kind of go back and forth right there. You're almost done.
Oh yeah, that's good.
Yeah, we did about 600 shots.
Thank you.
Perfect. And then if you want to do nose, which now nose kind of comes up to here. So
Yeah, I'll probably do a couple more over
you
there.
can get really close to this here.
Okay.
Oh, you timed out. Good job. Say just go a little slower and try to stay as perpendicular as possible.
Oh, it's so heavy. Oh my god.
As on.
Yeah.
As
Oh, I'll do it. Stay on.
Can you tuck your lip for me a little bit? Can you tuck your lip just so I? Yeah, perfect.
I keep going. Try to come all the way to the center. There you go. And go like closer to the nostrils. Yeah. That should be good. And then you can just go to the chin if you want. You can all flow in one nice pattern. And you did her nose already?
Yeah.
Okay. And then forehead.
Just the forehead.
So I'd switch that position.
Yeah, I'm gonna
You can
try
get that feel
this.
for it. So just go from like here to here.
Oh, sorry.
Oh no, happens. It's always right when you're getting ready to start. It times out. Slow. Go slower and try to make a little more skin contact and be more perpendicular. You can take your time. Going a little slower helps you stay in more control. Okay. Good. Perfect. And then all you gotta do is her temple area. Okay. All right.
It's good.
So then we'll pause that. It was 4,500 shots total, which is pretty even because I was at 23. So which is a perfect amount. And then you can see all the pigment starting to lift. Like not, it doesn't lift, but you can just see it coming out. And that nice uniform erythema is exactly your clinical endpoint. And then at this point, I would just take out that collimated tip. So just pull. Great. And then grab the square tip and fractionate it. And I'll just go ahead and show you how to test doing that testing protocol.
Mm-hmm.
So, like I said, the minimum I started is 1.5. I don't bother with 1 or 1.25, unless I was doing like Fitz 5 skin. We don't really recommend Fitz 6 for MLA, but the pico toning, what we just did, we can. But we go up to 5 with this.
Doing good?
So this one, you're going to feel it a little bit more tingly.
Okay.
So turn away, and I'm going to pick a spot on her jawline. One, two, 3 passes. Okay. So then you just kind of wait. And you can see it starting to turn a little pink. And I see one little petechiae so far. But if we give it a few more seconds, you should see a little bit more. And you should still see a little bit more of like an obvious line of where we were. But it takes about a minute. And if it takes a little too long and you're not really seeing as much, then I'll get a 1.75. So I'm going to do a little line above it. That sounds better. So you heard a little bit more snapping, and you can actually see the light
Mm-hmm.
bouncing a little bit, and I like to see that. And you can already start to see a little bit more erythema going in this direction. And yeah, there's some petechiae forming. See them here?
Yep.
Now, if she was like wanting a full face rejuvenation, then I would go higher. But since we're just kind of following a melasma protocol and just treating for that, I'm happy with this.
Okay.
But yeah, you can definitely start to see
Yeah.
a lot more reactive there. And then you're right on the money. I'm gonna just kind of focus on those problem areas, but just give her a little bit of umph in
Okay.
the nasal labial fold area, and then a little bit on the jawline.
It's only 1:30, Stacy, by the way.
Okay. I already did a little bit down here, but I hear more snapping.
Mm-hmm.
So I'm kind of letting it tell me where I need to go. That's all I would do. Is that chiller?
Yeah.
Put some on her face. So now she's getting a little warm. I think this device being on is.
So this is their own like Zimmer.
Oh, they have their own
It's
Zimmer?
called the Siberian. It's supposed to get colder than a Zimmer, and it doesn't have the 30-minute warm up that a Zimmer does.
Really?
It takes about, once it's on, it takes about a minute before you feel it get really cold. Oh, it feels good.
Oh.
But it's a little warm in this room.
Yeah. I think these drapes make them pretty warm.
Remember to keep it like short distances so it's a little more comfortable for you. So like just from here to here, and then go up here separately and stay up there. It'll just really wear your arm out.
Yeah.
And then go up here and spend a little time up there. And then do a little upper lip and nasolabial. And a little jawline. Oh, a little slower. Sometimes if you go too fast, there's like gaps. it.
Perfect. I'm gonna put some moisturizer and SPF on you. Only the IPL has a finger trigger. Everything else, yeah. Well, Pico and Q Switch normally does have a foot switch, but
Yeah.
like everything else.
I think people prefer using.
Oh, not me.
Oh, really?
I think
Yeah.
it depends on the laser. There's sometimes where it's nice to have a finger trigger, and then there's sometimes where it's like it's nice to just melt down.
Yeah. Yeah, you're warm.
There's a little bit of warmth. I think it's a little warm in here. But yeah, that Siberian was on low.
Oh, it was?
Yeah.
Wow.
And also, Stace, she says, she doesn't recommend numbing for anything except Pico tattoo removal, not even like, well, and Q switch, not even the Pro Deep, the 1320, or the 1540, or the dual mode,
On
the Erbium.
multi-application.
Now, if I'm gonna go really aggressive,
Not even
like,
an Erbium, really?
no. If I'm gonna do dual mode, and we'll talk about that at more higher aggressive levels, and I'm gonna do a very aggressive Pro Deep, then yes, you can numb for something. But
Who's getting an Erbium?
No one, because Dr. Matt's not here.
Oh,
I invited him.
you did?
Yeah.
there you go. Yeah, I'll finish my deal.
Thank you.
Yes. Oh wow. She's a little bit. But this is why it's like
My shoulder hurts
versus
a little bit.
unit.
A little sore.
And then there's no articulated arm.
Oh, because the
Everything's
the hand.
Yeah.
What's the advantage of that?
So articulated arm, it's not losing energy, bouncing through off the mirrors, so it's just going straight through. I don't love articulated arms because I feel like they like fall, they get in the way. And this plugs, I mean, it's affordable. Now you can get a Pico under 100,000 with wearing it with the Etheria. So the Etheria base, it's hard for me to say because I mean it's changed in prices a lot, but it's started around 40 grand, I think is the average, and then this is around 45 to 50,000. So you can get it separate. So it's all a la carte. So you buy your base and then you pick whatever hand pieces you want to go with it.
Okay.
So it's fully customizable. You can start with one hand piece and then as you grow or you pay it off, you get another hand piece. So some people just want to try something.
So it's the same base.
It's always the same base and it will always house our hand pieces. So it's not, Vydence has been in business for like a long 20 years. People that have had units for 10 years and they'll never come out with like a new handpiece that won't plug into the original base.
And you don't have to do like a software upgrade, or it's already in there. You just buy the handpiece.
Mm-hmm.
That's cool.
Yeah, it always houses. So, yeah, it's a little heavy, but I think like I don't know. I've gotten so used to it.
Right?
Yeah,
And like you said, you're not dealing like arm and all that.
Yeah.
And all the handpieces are like that.
Yes. This is just by far the biggest and heaviest. Everything else is like a feather compared to this, but Pico obviously needs a lot more components to it. So it's got a little bit of weight. Is that like me?
If you're gonna be talking,
I'm not seeing it.
so people go
How many people do we have?
pretty still.
Fine.
Good.
Yeah.
Oh, look, here's a little red. Nothing crazy.
And then how like a hat on.
You have SPF on.
Hey.
Hey.
How's it going? Good.
That's good.
Results, yeah.
Good.
What? You prefer rain, yeah. Mark, Cole, Sibo, Rose, show with that, y'all. I didn't even have to wear my frustration.
Yeah, it's really good.
Doesn't it?
Yeah.
Yeah.
You like it?
Only Pico to handpiece.
Yeah.
They're very heavy.
But I mean,
Hard to control. I mean, people nowadays.
I feel about the Lucent sometimes. Lucent is pretty heavy.
Yeah, but she said that was the heaviest one. So.
Yeah.
Well, thank you.
No, it looks good. Of course. See you tomorrow. Okay, our other Pico patient should be here. I'm gonna run across. He's in the other building. I'm gonna see if he's still planning on being treated. And that he knows it's now. So 1 second. Oh, here.
Had some. So Lena has some.
You could remove the pencil lead from my hand.
I don't know if that works.
Mhm.
I have one. Where is it? Fifth grade.
Yeah, I mean, I think you try it.
I don't want to break up lead into your lymphatic system.
Fair.
Something about that just doesn't sit right.
some dark circles under eyes. So that would be good. Unless you put the sticky up a little bit.
I
and
could put
can
the sticky
pull-
up a little bit.
I can pull orange.
I need to get them anyway. I forgot to grab them. Can you scoot up a little bit, Zach?
Yeah.
Thanks. This is just alcohol. You can keep your eyes closed. Does it stink?
Just a little bit.
Okay, let me look at those eye things.
No.
Oh,
Like the offset.
any other ones in there right now. Yeah.
So close your eyes, but I'm gonna pull your skin down a little bit.
Oh, I don't know why I got these ones. I need to grab a smaller one. So sorry, everybody. Oh, why? Oh, thank you. That's sweet. That's sweet of you. Oh, his lashes.
You got nice long
know.
eyelashes.
Trying to like scoop them back. There we go.
Good. So yeah, this is what I want to try to treat right up in here.
Scoop. Okay.
If someone had metal eye shields, I just kind of scoot it up to the lash line and really pull the skin taut to treat.
Perfect. Okay. Everyone got glasses on.
And I'll show you.
Mhm.
And I would just leave it on the lowest setting.
Hey, bro, don't forget to film on my phone.
He's right there.
So I'm gonna start actually on the forehead.
Okay.
How you doing, Zach?
I'm telling
No pain, right?
you.
What'd I tell you?
And then right when it starts to feel awkward is when I switch. So I just make a mental note that that temple, that corner area, I'll have to treat. But my spiel that I say during trainings or whoever is holding the laser is the most important person in the room.
Mm-hmm.
So treatments have to be comfortable. And if positioning's uncomfortable or awkward, change it. swatch hair, but I can go right. You can see how precise it is. So you just go right to the hairline, and then I switch positioning. And now I'm going to do this back corner in the temple area. I know shots.
Nice.
Okay, and then I'm gonna do around the eyes. So this is where I hold it like this because I feel like I have a little bit more control. And I pull the skin. And I do just small sections at a time, just making sure I'm constantly moving. It's got a little scar there, or probably a divot from glasses rubbing that darkens with time. And I won't do too much down here because I want to do more MLA. So hold this when I take my wrist. You ready?
Yeah.
Oh, wait,
Oh, I
like,
waited.
like,
Sorry.
that's okay. Oh, we've all done it lots of times. There you go. And then start coming back up. So you could focus on the center forehead over. Just go a little slower.
here allows for deeper penetration of the energy, about 900 microns deeper on average than a 1540 or a 1570. This also allows you to go a little bit faster. So erbium glass doesn't allow for high repetition rate. It's a slower treatment. But you can see with our Pro Deep, you can move it pretty quickly. And that is not a typo. A lot of people think when they see ND-YAP that that is wrong. But the P stands for perovskite, which is the crystal that is used to garner this wavelength. This is basically saying the same thing. It is a photothermal effect, the target chromophore, of course, being water. And this is a histology showing, you know, the depth and the width of the coagulation that we can achieve using our Pro Deep. And this is an example of why I say that you need our chiller. So, and you may have encountered this with erbium glass. It can blister pretty easily if you're a little too aggressive or if you overlap a little bit too much. And so if you don't have a chiller, we don't recommend that you go over 90 millijoules. With the chiller, I mean, I've gone up to 130 as that picture on the right will show. So you can see, you know, as a provider, as a patient, which treatment would you rather have, especially if you have deeper fine lines or wrinkles or acne scars. I think anyone would choose the image on the right. And this is just a histology showing the difference between non-ablative and ablative, complete ablation and vaporization of tissue versus just coagulation. And there's pros and cons to both. And I honestly like to combine the two, which there's a lot of devices that combine non-ablative with ablative now. But if you just had to pick one or the other, these are the pros and cons. So the advantage of Pro Deep is that it is safer. There's a lot less downtime, about 24 to 48 hours. It doesn't compromise the skin barrier and a lot less risk, not no risk, but less risk of PIH. This is a very versatile handpiece. So we're going to talk about the ability to treat active acne, the ability to treat scarring, any kind of scarring anywhere on the body, rejuvenation anywhere on the body, and then hair restoration. And the results are really good. The disadvantage is that it's a high number of sessions. And the way that I, you know, kind of quote somebody for number of sessions is similar to RF microneedling, which we're all pretty familiar with. So if I looked at someone's, you know, atrophic acne scars and they're pretty severe, and it would take, in my mind, at least 6 RF microneedling sessions. Pro Deep is about the same. And then ablative, you know, it's fewer sessions. You see clear improvement after first session, which is a disadvantage of anything non-ablative. You do have to be patient for your results. So that comes with the consultation and setting those expectations with the patient. And the results tend to last, you know, a pretty long time and patients are happy, but you do have that downtime. You have to have a solid post-treatment care plan in place and products to use, and there is a lot more risk associated when you compromise that skin barrier. This is just different effects of laser on the tissue, versions of ablation. So old school CO2, that was full beam, that is not really practiced at all anymore, to when they decided to fractionate it. And then fractionally, you know, the depth depends on dwell time or pulse width. And then versus coagulation, which is those columns in the middle. And again, it's showing you just the depth that we're able to achieve with the Pro Deep versus an ablative laser. So even aggressive ablative lasers can only go so deep, which is why I do like to combine them. Okay, so the technical characteristics, it is an ND-YAP, 200 millijoules maximum energy, which you will never see. I think the highest I've ever seen anybody go is 140 millijoules. Pulse width ranges from 3 to 20 milliseconds. Pulse width isn't as important for the Pro Deep as, say, like a long pulse or IPL. I tend to just keep it at 5 milliseconds. You can go up to 2.5 hertz in terms of operating frequency. That's a little fast for me. I kind of hover around 1.5 hertz, which is still very, very fast. I don't want anyone to get confused. You know, we're an international company, so there are certain spots and tips that are available in other countries that are not FDA approved yet in the United States. So it's going to talk about this 10 millimeter 400 microthermal zone tip. We do not have that. We do have the 8 millimeter 100 microthermal zone tip and the collimated 6 millimeter round. We have been able to, write protocols for everything the 10 millimeter could have done in terms of hair restoration with the 8 millimeter. The 10 millimeter acts a little bit more like erbium glass and can do a little bit of pigment, but is it my go-to for pigment, especially when the chromophore is water? No, you have other tools for that. There is an adapter for your air cooling, which plugs in with the Zimmer as well. So they don't have to have our Siberian. It plays nicely with others. But we definitely encourage cold air cooling anytime the Pro Deep is on. Even if you're under the 90 millijoules, we still like to have it on. So this wavelength is exclusive to the US. I have yet to see a 1340 on the market. So that definitely helps you sell and it stands out. And when you actually see it in action and you see what it can do and how powerful it is, I think you'll understand why we love the Pro Deep. I've been a provider for years and I've used all kind of modalities to treat acne scars, and I worked in dermatology for the last 5 years before I came to Vydence. And that was probably the thing that I always struggled with the most, was getting my patients really good results. And before I worked for Vydence, I got a Pro Deep, and as soon as I use this, I didn't touch another modality for acne and acne scarring. So you can kind of see, like, as it's working, it used to be a round spot, but now it's square. And you can kind of see a weird pattern in the background. This was done on someone's abdomen for stretch marks, so you can, that's why it's kind of random lines. Normally when we treat the face, it's a little bit more uniform. So that 100 microthermal zone tip is fractional non-ablative for surfacing, for light to moderate wrinkles, stretch marks, and scars, and also can be used for hair restoration. That 6 millimeter collimated, I'm not sure why acne lesions are not listed, but that is what I use to treat anything inflammatory. So if someone comes in with a papulopustular cyst or a flare of HS, so while it's in its flared up state, you can use this tip to treat anything inflammatory. It is a single shot over the lesion itself. And a lot of people think it's too good to be true because it's literally like one shot over a pimple, and it will be reduced by at least half by the next day. This is the interface. This is the Etheria. We're going to use air cooling, so you're not going to see the little cooling bubble here for contact cooling. But it will say Pro Deep. It'll say the spot size in the top right that you're using. Fluence is again in the top left. Pulse width is in the bottom left. And then frequency or repetition rate is going to be on the right. Same thing with the Xi. The clinical reference guide that comes from Brazil is a little small. It's not as in-depth. So Dr. Eubanks and I created our own, where we addressed acne, acne scarring, hair restoration, hidradenitis suppurativa or HS, as well as just resurfacing, stretch marks. So we kind of have a lot more indications and the recommended parameters to go with that. So when we do this, we're doing single rows at a time. Whether we're going horizontally or vertically, we tend to just kind of do a row in order. If you have a chiller and you're really comfortable and you've got some experience with this, you can do that like snaking pattern. The problem with that is it's stacking energy kind of close together. So if you don't have a chiller, we don't recommend doing that. We recommend doing single rows, so there's a little bit more thermal relaxation time. It is deceivingly powerful, this device, and as you're treating someone, nothing's really happening in the skin. It's a delayed effect. So about 2 to 3 minutes after you're done, all of a sudden you're going to start to see these red little squares. They're either very, very red or they actually look like welts. And so stacking or overlapping is kind of a big no-no here. That being said, you want to try to get your shots close together. So it takes practice. It's one of those things where you don't really you can't really see where you've been. So doing those rows helps to kind of keep you organized. This video kind of looks like she's overlapping, but what you have to understand is that the spot size is about a 10 millimeter by 10 millimeter guide, but the shot is only 8 millimeters. So it's going to look like you're overlapping a little bit as you're doing it, but you're not really. And if you have your chiller on, the risk of blistering goes way down, like significantly. Like you can stack and still not blister someone if you have the chiller on. So if you overlap a little here or there with the chiller should not be an issue at all. The problem that you can run into is if you don't have a chiller going, even if it's at 90 millijoules and you overlap a little bit, you can have little blisters start to pop up. The thing about the parameters for this treatment is it tends to get really redundant. Pulse width is anywhere from 3 to 10 milliseconds. I like to kind of meet it in the middle at 5. And your fluence is going to range from 70 to 140 millijoules. Pretty much for everything, except for when using the collimated and for hair. But if it's a scar, if it's a stretch mark, if it's acne scars, if it's resurfacing or laxity, it's all gonna fall into that range. And I always sold Pro Deep in packages of 4. So they might start at 90 millijoules and then every time they come in, I might go up 10. Or you can just start more aggressive if they need it. Start at like 120 and go to 125, 130, 135, and so on. You can do 2 passes, but I recommend, so like say someone had really bad acne scarring on their cheeks, I would do vertical rows and then go to the other side and then treat the other side of the face and give the skin some time to cool down before doing a cross-hatching pattern only over problem areas. I wouldn't do a global double pass treatment, if that makes sense. It's just not necessary. That's for the other handpiece that we don't have. And here, kind of proving my point, stretch marks, 90 to 140 millijoules, 5 milliseconds. You're going to start to see the same recommendations over and over. This is a good example of the welting that can happen. And someone just following patterns of stretch marks. If someone's stretch marks are purple or red, it would be a good idea to do IPL first, and then you can do Pro Deep over top of it. If someone's scar is hyperpigmented and it's brown, you can do IPL or Pico, and then followed by Pro Deep. And then you can even sprinkle a little erbium on top. We'll talk about that in a minute. Contraindications are all the obvious ones: pregnancy, lactation, photosensitive diseases, non-absorbable fillers like Bellafill. There's a possibility to form nodules in the treatment area. It's not common, and it's not even really common for people to have that kind of filler anymore, but if you do come across it, be mindful, and I wouldn't treat. And then herpes prophylaxis, so like cold sores, get them on antivirals about a week prior and for a week after, because if you do treat around the mouth, it can cause disruption there. Always use the cooler. Post-treatment, so even though we're not ablating skin, this makes for an amazing drug delivery, whether it is for hair restoration, or we'll talk a little bit about Pro Deep works great for hair restoration alone. Topicals are okay for hair restoration alone. When you combine them, it's an amazing treatment. So whether it's exosomes or even just minoxidil, combining it with Pro Deep will allow better product absorption into the skin. And then for, a facial treatment, if you have a favorite exosome company that you use, whether it's plant-based or adipose, it really helps absorb into the skin. Soothing lotions, like Elta makes a really great post-laser enzyme gel. I love that post-IPL, and I would also use it post Pro Deep. You can even do LED light therapy after a treatment to kind of help calm things down. Makeup can be used 24 hours later. Again, we'll always talk about that website that you can go on. There's no consumables, so you just have to keep everything clean. Make sure you disassemble one tip at a time. Clean, with isopropyl alcohol and gauze and like maybe a cotton tip applicator for the lens. You don't have to do this after every patient, but I would say like at the end of the day, if you've been using it a lot, or at the end of the week, if you're using it kind of intermittently, this is good to do. Cases and results. And then we do have a clinical library for hidradenitis suppurativa. So this is before and after using that 6 millimeter collimated tip. And then you would use the fractionated tip to treat globally. There are providers that do use the ProDeep even while someone is on Accutane, low levels. But I think the rule about 6 months waiting for treatment is a little antiquated. But again, you know, as a Vydence employee, we still say follow protocol, but we have plenty of providers in the world that are using, you know, as a patient is titrating their dosage to a higher dose of Accutane, they will start more aggressively with the ProDeep and then decrease their fluence as they are on a higher dose. But it kind of works alongside of it with calming the inflammation, the inflammatory side of the papules and pustules, and then it will help with the scarring. That goes along with someone having more severe acne. Let me see. And ProDeep is pretty straightforward in terms of like the science. It's something that you really need to get hands-on, I think, and practice the technique. But if you've done a 1540 before, you can definitely do ProDeep. Okay. No questions. Okay. All right, so with that, we'll move on to our ablative handpiece, which we use erbium YAG for our ablative handpiece. You know, I'm very familiar with CO2 as well. I think they both have their pros and cons, but I do love erbium YAG as an ablative laser. You can see from the target chromophore and absorption curve that the 2940 wavelength has a much higher affinity for water than the 10,600. There's a pro and con to that. It doesn't take as much energy to vaporize tissues. When you hit that foot pedal, you almost can't even blink fast enough before you will hear a loud pop and you will see plume and you will see tissue vaporized. I think if anybody has run a CO2 before, they know that it definitely takes some time for each pulse in order to create those microthermal zones and to get that endpoint. Okay. It's like, is there a plane? So the cool thing about that is, you know, erbium YAG is very precise. Wherever you need it to ablate tissue, it will ablate tissue. It's a little bit safer, I think, for people that are a little bit more prone to PIH because there's a lot less energy going into the skin, a lot less heat. The problem with that is that, you know, CO2 will tout that they get more coagulation, which leads to a little bit more skin contraction and tightening. So what Vydence has done is created their dual mode to try to mimic a CO2 without being a CO2. So I'm not going to go through the whole thing again. We've already seen these slides. We know the pros and cons between ablative and non-ablative. But here is where we can spend a little bit of time. So dual mode is called dual mode because that's actually a mode that you could put your device in. But before we talk about that, we'll talk about the different settings that you can do to lead up to that. You know, there are a lot of erbium YAG devices on the market that I've come across, and most of them only operate in the microsecond pulse width, maybe up to 1 millisecond. This one can go up to 5 milliseconds. So you are definitely getting into the dermis. You are going to see some bleeding. This is going to be a more aggressive treatment. The microsecond pulse, is going to be epidermis only. So if you want to mimic like a cool peel, you can definitely do that. We have we have two fractionated tips. One's going to be very dense and one's not going to be very dense. It's a 100 microthermal zone or 400 microthermal zone. If I'm doing a microsecond pulse, then I like to use that 400 microthermal zone and give someone a nice peel effect from it. This could be used for drug delivery. It can just be a nice, easy couple days of downtime laser peel. And the byproduct of kind of superficially peeling the epidermis is getting rid of some unwanted pigment. The downtime I would say is a little bit more than 1 to 2 days. I think that's certain skin types, but I would say an average is 3 to 5. The millisecond pulse, anywhere from 1 to 5 milliseconds, still in single mode. If you notice why it's called single mode, so you can do a microsecond pulse, a millisecond pulse, or you can stack them. But back to millisecond, this is a longer pulse, so deeper penetration, deeper ablation, with a little bit of thermal damage. And this is where, if I'm getting a longer pulse width, this is where I like the 100 microthermal zone tip, because I want a little bit more space in between those microthermal zones and have more healthy tissue to help minimize the risk of scarring. And this is done for like some fine wrinkles and some rejuvenation. And I would definitely say it's more of a 5 to 7 day of downtime instead of the 2 to 4 days that's on this chart. And then the dual mode. So this is when they combine the microsecond and millisecond pulse. So you will actually hear 2 clicks every time you fire it. What they are trying to accomplish is mimicking a CO2 here. So we're going to get the depth from that millisecond pulse, and then just the act of stacking them is going to create a really nice coagulative effect around each of those microthermal zones. So this is kind of how we compete. And I would say anywhere from 7 to 10 days of downtime, depending on your settings. And there's a lot of room to do even a lighter dual mode versus a very aggressive dual mode. And when we play with settings, you will definitely see that. The smooth pulse is not approved yet for the US, but we do have that coming, and I'm excited about it. We have InLift, which treats inside the mouth. And then we do TrueLift, which is specifically for under eye. And then the Athena is for vaginal rejuvenation. It is a 400 millisecond pulse broken up into 8 different pulses. So it's 8 shots totaling 400 milliseconds when you combine them, but it is painless. It almost looks like it's not ablative. It is technically, but to the eye, it doesn't look ablative. And it's about 24 hours of seeing that little bit of frosting. Really no need for post-treatment care. It's an incredible treatment, and I'm excited to have it coming soon to the US. So obviously we don't have all of these tips. What comes in the kit for the US currently is the fractional 8 millimeter 100 microthermal zone tip and the 8 millimeter 400 microthermal zone tip, as well as the collimated 6 millimeter round. Everything else is coming essentially. So I'm going to skip through some of this. So bear with me here. Okay. Also, ignore the commas in Brazil. That's a decimal point, but it's 3.5 either hertz or 3.5 millijoules here. So this is showing you the collimated. The collimated is for like shaving down lesions, but it is limited to the 6 millimeter spot size, so you can't really adjust that. But if you have someone with some SKs that are a little bit larger and you want to shave them down, you can definitely do that with the collimated tip. And this is in single mode. As you can see, it's a microsecond pulse, single mode. If you tap single mode, it will change it to dual mode, and then your screen is going to look like this. This is where I'm going to kind of exit out of the preview so you can see my cursor here. So this looks like a lot when you first change this screen, a lot of numbers, and it could be a little overwhelming, but all you have to know is that this top number goes with this top number. So the ablative part is going to be your millijoules here with your pulse width here. And then here's your coagulation. So then this bottom number is going to go with this bottom number. So it's always going to be a microsecond pulse first and then a millisecond pulse after that. So that's where these numbers go here and then these numbers go here. In order to change them, you're going to tap this screen and there should be a little bubble that will illuminate. And then say you just want to change this top number, you tap this. If that bubble is illuminated, then you go up and down. Same thing for down here. Don't worry about that. Same thing, here is the 400 microthermal zone, 8mm fractionated tip on the Xi, and this is the interface. And then you would just toggle single mode or dual mode on the bottom. And here's what dual mode on the bottom looks like. There is a clinical reference guide with a lot of really great pearls, you know, things that to keep in mind before having an ablative procedure. Sorry. And I am a big stickler for having a solid post-treatment care plan. And as a trainer, before I go into an ablative laser treatment or training, I make sure that they have a plan ahead of time and I send them my recommended post-care. And there's different recommendations for different skincare lines. So I kind of leave that up to them. But as long as they have something that is safe and approved for ablated skin. And then I like exosomes after. I even like that the Skin Pen, the biocellulose masks.
Yeah, those are really popular.
Yes. So I keep them in the refrigerator and then I will pop those on after the treatment. It feels really nice for the patient. A lot of times they drive home in it. And the other thing I talk about is our vinegar soaks.
Yep.
So we lose a lot of control as providers as soon as the patient leaves the building. And I've seen some funky things over the years of patients doing some weird things and not keeping their skin clean. And if I talk to them about the benefits of a vinegar soak, you know, what I explain is that it feels amazing. It takes the sting away. It helps with swelling and lymphatic drainage because you're kind of pressing it into the skin first thing in the morning. You're going to keep it in the refrigerator so it's nice and cold. What I know is that it has antimicrobial benefits. So the chances of folliculitis or infection goes down when you're doing this, but then also the patients actually enjoy doing this because it feels nice on their skin. Different indications that you can treat. Sorry, this is talking about the intraoral, which is really cool. I did get to do this in Brazil, but we're getting that soon. And also can be used to treat directly on the lips. To help naturally plump the lips. You can also do Pro Deep on the lips as well. This is and you can hear the 8 counts. This is the True Lift for around the eyes. This is going to be, sorry, that's really loud. This is showing that they're shaving down, I think, a seborrheic keratosis. So they're just firing it a few different times and then we'll take like a scrubby gauze and just wipe it away. This is going to demonstrate just how fast you can go and how instantly you see skin vaporize. I know this is my favorite thing to do. And this is all happening in real time. So you can put this, as long as it's on single mode, up to a millisecond deep. So you can still do a dermal treatment going this fast. You can set it to 5 hertz and it's literally like painting a canvas. So I think, and this person I think is even taking their time and they've had to go over a few spots because they made some gaps, but I think it's like 45 seconds for this whole video. But just think about if you can do this fast on the back of a hand, how fast you can do someone's chest, their neck, and someone's face. Yeah. It's very, very, very fast. This is also another treatment that's coming. This is going to be more of that dual mode treatment. So we do have the chiller hooked up to it. And I was explaining to Kiki that I don't even really numb for this. I don't numb for much except for tattoo removal. This being included, I have the chiller on and it seems to really mitigate any kind of discomfort. But because there's not a lot of heat building in the tissue, most people don't feel that much discomfort during an erbium treatment. If I was going to be really aggressive, then I would consider numbing. But for most people, where I layer like Pro Deep and dual mode, I'm doing a lighter ablative treatment anyway, since I already got that coagulation and depth from the Pro Deep. So I really just don't even see the need to numb too much. I mean, we all have those patients that don't have a high pain tolerance, and of course, accommodate them. But most people don't like numbing. They don't like the way it makes them feel. They don't like spending an extra 45 minutes in someone's chair. We as providers don't like a lot of people sitting in our chairs wasting time numbing. So if we can get away with not numbing, I say why not? So proceed with caution when doing anything ablative around the eyes, and make sure they have a need to treat around the eyes. So if their eyes look like this, then yes, they are a candidate to treat around the eyes. With dual mode, this was done. And you can do dual mode and just set your pulse width a little bit less, because again, it's going to be very precise ablation, and it's not going to cause a lot of trauma. This is something you should wait at least 60 days, I think, before treating again if you had to. But the problem with treating around the eyes is the skin is so thin, and unless someone had extra skin there to treat, you could age someone if they're not a true candidate. And I've seen providers around the eyes that looked like the picture on the right. And if it's done too aggressively, then it could take about a year for them to recover from that, where they will look older and it'll look worse for a while. So contraindications are going to be all the same. Again, very obvious ones. And again, the non-absorbable fillers. Botox, I had a provider recently push the boundary and did it 10 days instead of 2 weeks, or I think it might have been 7 days. And it did cause the filler to migrate. And they had an issue. Luckily, it was a friend of hers, so it wasn't a horrible thing, but we really do want you to wait at least 2 weeks to 30 days after Botox application. Same thing if they have cold sores, get them on antivirals. If you do numb, and this is the problem with ablatives, you have to make sure that skin is completely clean, bone dry, no residue can be left behind. Because if the chromophore is water, then it's a highly sensitive attachment to water. If there's anything on the surface of the skin, it will be attracted to that and won't do anything to the tissue underneath. So if you do numb, you have to make sure it is completely clean. Also, Brazil likes to use chamomile tea compresses. Not a fan. It doesn't really do a whole lot. So ignore that and stick with your vinegar soak. And then Cicaplast to me is a little too clogging, so I wouldn't recommend that. I like good old-fashioned Vaseline, but I hold off on applying ointments until at least day 3, until it gets crusty. Those first 2 days where it's just kind of raw and swollen and red and hot, I don't think you should form an occlusive barrier necessarily and keep all that heat in. I like exosomes or like hyaluronic acid. That's a good quality. Like Hydrinid has a really good quality one. Okay. You are going to need to clean these after every treatment in terms of like taking them apart. You will see so much plume build up on these applicators very quickly, because you will see a lot of smoke go into the air immediately. Smoke evacuator is completely necessary. It is necessary for anything ablative, but with this especially. And I would still wear like a mask. But it is going to be messy. You're going to see quite a bit. It looks like cobwebs on it afterwards. And this is talking about like the vaginal rejuvenations that can be autoclaved. Okay. So there's some cases and results of people doing just erbium, which again is great, but I think it's even better when you pair it with like a non-ablative. But this woman's forehead and around her eyes looks really good. And same here, like that cheek is giving some lift, it's smoothing out some fine lines. And this is only after one single session. And this is dual mode at a pretty low fluence for both the microsecond and millisecond pulse. This is a cool comparison of CO2 versus erbium. So the CO2 laser was performed on the right side of the face. The erbium YAG was on the left side of the face. And you can see, it's looking straight at it. The left side looks better. You had to do more passes with the erbium than CO2, but not only did it give us better results, but the patient reported quicker and easier healing time. And this is another double-blind study comparing CO2. And this has even been used to treat for snoring on the soft palate. And yeah. Okay. So it's a lot quicker to go through these didactics.
Yeah.
It's more about getting some hands-on practice with it.
Perfect. Kate, you want to go do a pro deep treatment first and then after dual mode?
Yes, and we'll
have
Hairband.
comedonal acne.
Oh.
Oh. Stop touching your face.
Well, and it's your hair too.
And it's your hair.
Okay. Interesting.
We're gonna
Why isn't it on
overlay.
my forehead? Or is it on my
It
forehead?
is on your forehead, just a different kind.
Okay.
Here is probably speaking to internal gut inflammation.
Yeah.
Up here generally tends to be more products,
Okay.
hair products if it's on the hairline.
Okay.
Um,
Those don't turn red though, right?
Nope.
Just kind of like dirty pores or something.
they're clogged.
Clogged pores.
So you have a condition called hyperkeratinization, which is leading to all of your acne, but down here is getting inflamed, and that's due to like gut health or do you brush your teeth and like does toothpaste go outside your mouth a lot?
No, not
Okay,
often.
good.
Not often.
Sometimes they can get irritated. That's like more perioral dermatitis
Okay.
and just flora and allergies from nasal drip.
I don't have allergies.
It's good.
Or-
So it's more gut health related then.
Okay. Yeah. That would make the most sense.
But I will tell you, this is the easiest to clear up. It's this stuff up here that is the hardest to clear up.
So that's good that it's not the other way around.
Yeah. So in order to clear that up, it has to come out. So extractions, peels, or if you do this laser over comedonal acne, it will cause a purge. I should say that in front of Kiki. So I was explaining to him that you can treat over comedonal acne with the ProDeep. The problem is it's going to cause a purge, which is not necessarily a problem. It has to happen. But you have to warn your patients that it's going to look worse before it gets better. Kind of like if you were to start a patient on a retinol and they've got a lot of comedonal acne, it's going to erupt, but it's coming out. But just have that established during the consultation. But inflammatory acne, papules, pustules, and cysts should improve pretty quickly after the treatment. And then they need to be following a really good home regimen because acne is multifactorial. You know, a laser treatment's not going to cure it, but, you know, a laser treatment plus a really good at-home routine will lead to clearing up the skin. Okay, gloves. And whenever I'm treating for like acne and acne scars, I always start with the acne first. And then we would treat the scars over top of it.
What about shaving? Does that like inflame it or does that just create like weird irritated bumps?
It just depends on how sensitive you are and if you have a propensity to make like ingrown hairs.
I don't, but I haven't been able to like use
A razor
a
because
razor over this stuff because I'm like
it hurts.
it makes it more obviously like annoyed.
Yeah,
But like when it's gone, like when my acne is gone,
no problem.
Yeah.
Yeah, you're essentially just kind of irritating it further.
It's like you're look at me and then hold your breath. Let it out through your nose. Let your breath out through your nose.
I did.
Oh. I'm sorry, I didn't
No,
hear
no,
it.
you're good.
Like, look at me. Okay.
Thank you, ma'am. And you have eye shields for him as well. Okay. Thank
Got our
you.
yes, thank you.
You're the best.
Your card will come in.
Perfect, thank you.
And your receipt.
Oh yes. Did you know
Hold on, it was $4.11, but I
Joe's gonna get mad at
yeah, I'll maybe write it off like it.
me? No, it's okay. Thank
Oh,
you.
it might be the back. Look at the back.
Okay. Oh yeah, it is.
Okay, good.
Thank you. Okay.
So can you go ahead and press the middle start here actually. And then when I'm doing pro deep, I tend to go up pretty high, almost full blast.
You have them hold it?
No, you can attach it,
Right.
which let me see. Yeah. Um,
Far away.
technically you should, but just don't look at it.
Here.
I'm not for blood.
Yeah. So this is removable, but this will slide right here. And then
You guys think
Okay.
what is happening?
we're getting set up. I'm not gonna shock you. Don't worry. I'll count it down.
Oh no, you're good. It's like it felt like you were like
There.
putting something on my arm.
Oh yeah, sorry. You're gonna feel the hose of the cooling. So I'm gonna be blowing cold air like this. Okay. We're gonna start with the acne first. So it's a single shot, centered in the middle of this tip. There's here. And it's the same setting every single time. Okay. 15 joules, 10 milliseconds. That's it. So goggles on. We'll start with this one here, okay? So green light is on, so it's ready to fire. Center the acne lesion in the center here. 1, 2, 3. How's that? See? And then see here. 1, 2, 3. 1, 2, 3. 1, 2, 3. And you can see I'm intentionally going slow because I want the air to get on the lesion before I fire it for a few seconds, just to help with any discomfort. 1, 2, 3. 1, 2, 3. Sometimes I'll feel with my finger to see if I've missed any. I'm not going to do these comedones because they're not that bad and I don't want to cause it to worsen. But that's it. You want to do the other side? Got it?
Oh, sorry.
You're good.
So start with maybe like the one down here.
There's like crazy shadow.
It's you.
No,
Or
I
no,
think
it's not.
this.
Okay, maybe come this way.
It's like right over the lesion.
Stand behind him, or stand on this side,
A little better.
right there.
Have to look for.
Okay. Mhm. Here. Here. And here. And here. 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 Okay. Did you do that lip one? Yeah, I did that one. Yeah.
This one I could probably do.
Yeah. Okay. All right. So that's literally it. You don't see any more, right?
No.
So I'll put it on standby and we'll just make sure we disinfect that. And then we're going to do this. And this is where the technique is a little bit, and what I would maybe have you do so you can see is I'll stand on this side and I'll do this side. So it's a little bit of a harder side. And then I'll have you do the other side.
Okay.
So because you can't see where you've been, sometimes I use my finger as a guide over my row and I just move my finger over so I know what row to start next. You could also use like a white pencil and kind of map out your rows if you wanted to. That takes a little bit too much time for my liking. Actually, sorry. I think I want to go a little higher, so like 100 millijoules. And I'll show you like one tap at a time versus like keeping the foot pedal down, that pace. And then if you're treating by the ear, just be aware that cold air is blowing and nobody likes cold air in the ear. So kind of cover it a little bit. All right, 1, 2, 3. Okay.
Mhm.
So that's single tapping. Now I'm going to press and hold. You okay? Sorry.
No, that's good.
That's half the face. So you can see how fast you can go with this. I like to be nice and do jaw lines. He doesn't really need it, but if you had someone with a little bit of laxity down here, full face doesn't end here for me, it ends here. That's it. And then if you see now, nothing was really happening as I was doing it, but now you're starting to see how red it's getting, and you're going to start to see little squares start to form. Men don't show it as much because their skin tends to be a little bit thicker, but in someone like me, I would look like I laid down in a waffle iron. This is already looking good. So I would do vertical rows. I think it helps you stay a little bit more consistent because if you went horizontal, because of the curve of the cheek, people have a tendency to start bleeding into the rows that they've already done. And again, shorter distances help stay accurate. So everything's ready. I would just start out with ones at a time until you feel really confident and comfortable with your spacing.
Thanks. You ready?
Yep. Good. I'd rather you have gaps than stack or overlap too much,
Okay.
especially when you're first starting out. Wait, you're going a little off course. So try to start at the bottom and come toward you. That was keeping you nice and straight. I think he needs to be lower for you. Okay. Now just kind of go straight up and down. And then fill this part in, like here. Okay. Now, yeah, go down. And you don't have to push in, just kind of lightly touch skin to it. And treat like nasolabial down. And then you're gonna kind of come down here and do short rows from like here to here, like boom, boom, boom. Your rows need to be a little tighter together. Perfect. And then do that spot there. Good. And then try coming towards you and doing like 2 rows on the jawline. If you want, you can press and hold. Should be a little easier. There you go. And then just come off it when you're at the end. There you go. Nice. Good.
Forehead?
I don't really want to treat his forehead because I don't want to cause this to break out because it's not that bad and he doesn't have any wrinkles or anything to treat. I want to focus on lower face for him and try to clear this up first. Perfect. Oh no. If he started using that Differin gel and then it caused him to start to break out and looking a little bit like this, then you can do up here.
Okay.
But I kind of want the retinol to start. What are you? Okay, it's saying defrost. I think it needs to be turned off so it can chill out for a bit.
Do I turn off here?
No, the back. Okay. So, how was your first laser experience?
It kind of just feels like it's so weird. It's
Like a little rubber band snap? Isn't that crazy? It looks like it's starting to dry up almost.
When it was close to my temple, it's weird because you could see a flash of light.
Yeah.
Is that from?
It's still light. It's still, so laser stands for light amplification stimulated through the emission of
I
radiation.
did not know that.
Yeah.
So for the dual mode, do I need to wheel in his eye?
Dual mode will plug
I
right
will.
into this.
Plug in here?
Yeah. The only thing that the Xi will do that this can't is doing that smooth pulse, which
Okay,
we
that's
don't
what I
have
saw.
anymore.
Okay.
Yeah. Or you guys don't have yet. And you can see like this can be a very fast procedure once you get a little bit of practice in. And then you'll notice like your spacing will get better and better with more practice. It's like a muscle memory thing. And you're going to be a little red. In about an hour, it's going to go down.
I just we can buy it.
Mm-hmm.
That was the last treatment of the day, right?
Yeah.
For people, yeah.
Okay.
We're
Now
going
we're
to
doing the cucumber.
eggplant.
The plant.
Yes. We have to get our vegetables right.
I don't eat those.
Ugh,
Powder.
this is why, oh my God, your poor skin. Am I live? Still. I'll take this off.
see.
because there's nothing engaged. So we'll start with collimated. And we just start with like 2 hertz. And you only want to do microsecond pulse for this whenever you're shaving down a lesion, because you want to see the layers being taken away so that you don't accidentally go too deep and cause a scar.
Okay.
Can I just get
Oh, yeah.
Thank you. I'll just go a little higher. We'll go to 3 joules. This will flash as well. And so that's how fast the tissue ablates.
Yeah.
Versus like CO2 where it's like, that's the technical term.
Yeah.
So literally like you blink after I put the foot pedal 1, 2, 3. Oh, let's make Mickey Mouse. Oh, I almost did it.
Ew.
And then my mentor in Brazil, Dr. Gardenia, she likes to do full beam collimated on the backs of hands.
Okay.
A little scary for me, but it's what she does all the time. But she would set it to 5 hertz. And then something like that. So very superficial. This is just epidermis. You can barely feel a difference in texture. So it just takes multiple layers.
Mhm.
You can kind of go back in, but that's collimated. And then, so if we wanted to switch things up to our
So that one's
fractionated.
mostly just used for lesions.
Yeah, that's all I
Yeah.
use it for. So you have your
AKs?
AKs, yeah. Sometimes the fractionated is fine for AKs, but like the more dense ones. So this one's the 100 microthermal zone, and then this one's the 400 microthermal zone.
Okay.
Personally, like you'll find settings for dual mode with the 400, or you'll find settings for the single pulse, but with millisecond pulse for the 400. My theory is that if you're going deeper and you're going more aggressive, then we should probably have something that's a little less dense.
Yeah.
So high density to me equals more of a superficial treatment
Mm-hmm.
because I'm trying to like peel the skin back. So I leave it at microsecond. I might go up to like again 3, and this is where I have a lot of fun with that 5 hertz, like we saw on the back of that woman's hand. But I'll do one single shot, and you can just see how dense that is. And then you can do. And this is something where you can overlap.
Yeah.
And you can do multiple passes, and you can feel it's probably a little bit of texture. But then if we increase the fluids, it's just for funsies, up to like 500 microseconds and 4 millijoules. You can see it's a little bit more charred
Yeah.
than the initial one. Yeah, that's your super dense. Really good for
peel,
pigment,
yeah.
retexture. And then finally, you'll see our less dense. This is where I do my millisecond pulse or my dual mode is with the 100 microthermal zone. So we'll go a little bit higher. We'll go to 15 millijoules, and let's go to like 3 milliseconds. This is where if you go higher than a millisecond, it'll force you to slow down. So I think 2 hertz is the fastest you can go, which is still pretty fast. And you can see the difference in density between there and here. Okay.
Yeah.
And then if I press and held down, and you can definitely smell
Yeah, it's getting
a
heat.
difference. And this is going to be dermis. You might see some pinpoint bleeding.
Yeah.
And you can actually feel the texture now in this. You can even go deeper. I think you can go to.
Do you ever stack the densities? Like maybe do 100 and then spot treat with the 400 on top for more creepier areas?
You could,
Okay.
or I'll stack dual mode.
Oh, okay.
So I'll spot treat with dual mode and treat globally with single mode. And if they
Okay.
have like a deep wrinkle from sleeping on one side or like a couple bad scars, then I'll just kind of spot treat. This is just a little bit more intense in terms of this is now 5 seconds. So you can see
Yeah.
a difference. Now dual mode. So all I gotta do is take this, not change anything, but I'm gonna tap single mode. And now it's gonna create dual mode. So this top number goes with the microsecond pulse. So my average, oh no, sorry, wrong one. My average is 15, which is kind of high. And then this bottom number, I go to like 25. Like 15, 25, 300 microseconds, 3 milliseconds. It does force you to slow down to 1.5 hertz, which is the same tempo as the Pro Deep. And if you listen carefully, you can hear 2 clicks. Hear it?
Mm-hmm.
You can see the difference.
Oh, well, yeah.
So it still doesn't, well, no,
Large.
I have to line it up with this one.
Yeah.
So definitely a noticeable char. Slight overlap. Definitely smell it.
Mm-hmm. Great.
I was just curious. Okay, now your turn. I don't know if you want to play with all 3.
Yeah, I want to try.
Okay.
This is the only time I get to do it.
I know, it's fun. So you're in single mode
5 hertz, yeah.
and you're still in microsecond. Oh, 5 hertz, yeah. And you'll notice.
Oh. Did I get you?
Nope. You'll notice that, your pace is everything. So if you go too fast, you're gonna have gaps.
Yeah.
And if you go too slow, you're gonna overlap. So it's you have to kind of find that nice in between. That's good. Perfect.
That one was better.
Isn't it fun?
Yeah, it is.
On skin, it's really like smoky, plumy.
Yeah. And you can do dual mode with any tip.
Yes, except for
the colmated, yeah.
You wanna
Oh.
like this thing? You can like make that bottom number. I think it goes up to 50.
The milliseconds.
No, the top bottom number. So it's already set. So go ahead.
Oh, the 10?
Yeah, go to that one. Wait, nope, one more. And then press up. And then press it again.
This one?
And then now go up all the way. Yeah, now fire it. You have to put it on.
Mm. Smell it.
Smell it. You can actually feel it.
Yeah.
Or it's hard to feel it on an eggplant.
Yeah.
Texture, it's like pretty smooth, but here you can definitely feel it.
Yeah.
It'll go through burn paper at that level. Try to find the pace and do like that slight overlap, like you're treating someone.
Well, because I didn't wait for the second one on the first one. Oh, it's
Good practice.
it's so smooth. It's like sliding.
There you go. You almost have to do a little pause for it to fire. And you have to.
Ooh.
Yep.
What one do we have on? The 100.
Yeah.
I want to try with the 400. Is this one magnetic? Maybe not.
Or maybe it's just this thing that's magnetic.
Mm.
If you hit single mode, it will change it to dual mode if you want to try dual mode at 400.
I'll do single mode first. I'll just go up kind of high and just see. Then I'll do dual mode, see the difference. Okay, now I'll do dual mode. Go to the highest. No, is that? Should I try it?
On eggplant, yeah, not on
No.
which you will notice that you cannot go as high with
Yeah,
100
yeah.
because it's so dense. It's
Or
not
as
gonna
fast,
allow
I'm
you.
assuming.
No, 1.5.
Oh, you still
hertz.
can go pretty fast. Okay.
1.5 hertz for dual mode.
Oh yeah, that's like pretty much.
It almost looks like full
Full,
beam.
I was about to say that. That's
Yeah.
almost full
So that's where
ablation.
it's like, okay, the risk of scarring and hyperpigmentation goes up. So to me, it's not necessarily worth it to do dual mode with the 400. So I stick with the 100.
Right. Yeah, that especially that overlap is like
It's rough, yeah.
90%, 99% of the skin. Cool. Fine.
That's it.